I'm a little old lady. Crocheting
Say
away.
that again, Anita. I missed that.
Apparently, I'm a little old lady crocheting away.
What are you
I was
making?
gonna ask, are you
It's
knitting or crocheting or?
Crocheting is with one hook. Knitting
Is it a scarf?
It's a blanket.
Are you going for a blanket? Okay.
Oh,
So, yeah.
My uncle does
cute.
the same thing, and let me tell you, like those are like the warmest, the heaviest. Like you can knock someone out with those. One of those things. Like after you're done, they're comfy too. Like they are really. You have one of those over you during the winter, you're good.
Mm-hmm.
Perfect.
I am. Some of you guys have seen me in class. Oh, you got a whole stockpile back there. Yeah, some of you guys have seen me in class. You'll know I am a huge fan of ponchos.
Yeah.
And all kinds of like wrappy stuff.
Yes.
I love them. Okay, folks,
Hint
let's
that you want one?
settle down. Say again?
Is that a hint that you're needing something?
No, that was not a hint. That was no. All right, my friends, today we are going to dig into the digestive system. We are going to talk about not just digestion, but the organs, some of the major processes that are involved. We are going to wrap up with a conversation about metabolism and nutrition. And it's going to be really, really fun. This is one of my favorite topics in anatomy to teach. I'm a big fan of the digestive system. So let's start out. Let me just ask you this. What are the functions of the digestive system? Generally, we bring it down to two main functions. All right,
Great.
we'll start with the name. Go ahead.
Were you asking us or
Sorry.
telling us?
All right, so the digestive system, generally we identify two main functions. Number one is digestion. Number two is absorption. And these are different processes. Digestion describes the processes of breaking food down into very simple molecules that the body can assimilate and use. Absorption is the process by which those small pieces are brought into the bloodstream or into the lymphatic system and then distributed to the cells of the body so that the cells can actually get what they need. So the digestive system functions to ingest food and water. It is a really interesting concept when you think about the digestive system properly. So you have an uninterrupted tube that runs from one end of you to the other end of you. And therefore, when you think about maybe the inside lining of your cheek, or if you've ever swallowed hot coffee and had a little bit of a burn running down your throat, what your digestive system effectively is a very long contained tube of outside that is contained within your body. So
We're
you
like a big donut.
are a donut. You are a donut. Congratulations. It's important that we really understand this, you guys, because even though it's a minor point, it does have a pretty important ramification, which is just because you put something in your mouth, it is not a part of your body. It is still technically outside the body. When you swallow it down into the stomach, it's still not inside your body. It is contained within a pocket of outside. Even as the food moves all the way through the digestive system, eventually something is going to come out. You follow me? That is the very same food that you swallowed. It never actually entered your body. It just kind of passed through it. So when we talk about digestion and the breaking down of food substances, we identify two types of digestion. And this is chemical and mechanical. Mechanical digestion is the physical, actual ripping apart. So chewing, right? You chew your food, you rip your steak into really, really small pieces, you chew it up until it's kind of a paste, right? Less the solid food and more of just like a paste. That is mechanical digestion. Mechanical digestion will begin in the mouth when you chew. It will continue in the stomach, which has muscle, so the stomach will churn and mix the food. Chemical digestion, as you may guess, is done by chemicals. So that's what you're thinking about when you think about things like stomach acid and bile and all that fun stuff. So we ingest food and water, and we break down the food, that's digestion. Then we absorb the food and water, that's the absorption. Now, your PowerPoint here says that an additional function is the elimination of waste. I am going to split some hairs real quick. The digestive system proper, we usually are looking at the functions of digestion and absorption. By the time we get to the elimination of waste part, we have moved into a different organ system, which is the excretory system, which is a whole system designed to excrete things, getting things out of the body. That would be things like pee and poop, but also things like sweat. And when you have to, like, let's say certain kinds of medications have to be processed, and then the body will expel those medications. Those are all examples. So yes, Dave is splitting some hairs here. However, all of the organs are really all tied together. So remember, guys, we are the ones going around the body, drawing dotted lines and putting names on stuff, right? We are the ones that say digestive versus excretory. The body doesn't really care what we think of it. The body just does what it does. Good talk. So when we look at the components, the actual organs, you will notice some familiar names, right? You've been hearing about your organs since you were probably in like 2nd grade, but there may be some additional organs that we haven't really either heard about or really considered before. And looking at this picture here, I mean, let's just be logical here. Let's just start at the top, and we'll just kind of work our way clockwise around. So starting at the very top, you have salivary glands. Salivary glands are glands, which means they are composed of 2 different kinds of epithelial tissue, and they produce a chemical which they then secrete somewhere. These guys secrete through tubes, which all end inside the mouth. I do think, I'm gonna swipe through the PowerPoint real quick because I do think that we, yes, okay, I'll get to it in a minute. Okay, salivary glands, they produce saliva. So as simple as that sounds, and yeah, it's pretty simple. Saliva is not horribly complicated stuff. But saliva does have a lot of really important ingredients that allow it to accomplish some definite functions. So saliva is not just the water in your mouth. Saliva contains enzymes and lots of them. Saliva is an active part of the chemical digestion process. So saliva is not just this inert watery stuff in your mouth. It actually has, it packs a punch. So moving on from the salivary glands, next we have the esophagus. This particular chart starts that word off with an O. It's just one of those archaic spellings. We're just going to move past it. We will say that it starts with an E. We all know what we're talking about. It's fine. It's fine. Esophagus. The esophagus is the tube that connects the oral cavity to the stomach, which in my camera doesn't sit up there. So stomach should sit right where your 2 ribs come in this little V. Your stomach sits right in that little pocket, and then very slightly to the left, very, very slightly. It's almost like the heart in that it's not so much that it's located left of center, it's that the organ itself is kind of tilted relative to the main axis of the body. So more of the organ sits on one side because it's tilted. That's why we put our right hand on the left side of our chest over our heart, because the heart is just tilted. So more of it is to the left of the midline but if the heart were to be placed kind of straight up and down, it really would be right along the midline. I mean, it's right in the middle of your chest. So esophagus, from the mouth to the stomach, and the stomach, again, when you find your ribs, stomach's gonna be right about here. So when your kids tell you that they got a stomach ache and they can't go to school today because their tummy hurts, and you say, show me where it hurts, and they point like way down here, yeah, your stomach is up here, they've got gas, the kid's lying to you, send them to school. Stomach's not, that's not where your stomach is, kiddo. All right, the esophagus empties into the stomach. Stomach is a stretchy, pouch-like organ. And I do have some very beautiful pictures, some very fancy stuff. First things that I just want to point out is this is only the digestive system. Everything else has been removed. So forgive me, but it does kind of look like a weird Pokemon. Let's start up at the top. So I understand that this is probably the weirdest thing that you have seen, but I want to talk you through what it is that you are looking at here. So we're going to turn this guy to face straight at you. So there you go. You are getting a bird's eye view. You can see the gums, right? Where the holes where your teeth would be. Remember, guys, teeth aren't, they're not considered part of the digestive system. It's weird. Teeth are just weird, and you just, all your weird stuff about teeth, you got to put it in a box and put it at the side somewhere. Teeth are weird. They don't count as anything. They're not bones, so they don't go in skeletal system. They don't go in digestive system. They're just weird, and we all die mad about it, okay? Cool. Teeth are not included. Right there in the middle, you have the tongue. So the two like weird ear flappy things on the sides, those are your salivary glands. Also called parotid gland, but salivary and parotid, same thing. The parotid glands are located, they're embedded within your cheek. So they are, make sure I posit this correctly. If I add on muscles, I will know that I'm correct. I was correct. Parotid glands sit superficial to the facial muscles. So they are outside the face muscle. Just wanted to be clear. So you got your salivary glands, and you see 1, 2, 3, 4 salivary glands per side of the face. So you have a grand total of 8 saliva glands, right? Now, we're going to turn around to look kind of at the posterior view. So you're looking kind of through the back of the neck. There tends to be a lot of confusion among students when we start getting into this stuff, because 2 of these structures have very similar sounding names, and these are pharynx and larynx. And I get it. No one consulted me when they named these things. I would have picked different sounding words, believe me. One of these days, someone is going to pay me to rewrite all the anatomy textbooks, and I promise they will be very well detailed, and all the terminology will be on point, and there will be no confusing or redundant names, and everything has 5 different names. But until they make me like dictator of anatomy, this is where we stay. So unfortunately, I don't really have a fun trick or like a catchy phrase that really helps stick it in your head. But what I can say is the pharynx with a PH is the back of your nose and the back of your throat. So when you huck a loogie, you're like, that is the pharynx. That's the pharynx. And the little app doesn't highlight the whole thing, but that's the pharynx. This is the back part of your nose where all that sinus drainage goes down, right?
It's where you
Now-
get a lot of sore throats. That's where
Yes. Yes.
you feel that
And
like sharp pain back there. That's the pharynx.
When you
yes.
need a nasal decongestant.
Anyone ever take like nasal sprays and things like Flonase or something like that? That's usually where we're headed. And when you spray that Flonase, anyone ever notice, by the way, just random side point, anyone ever notice Flonase smells like roses?
A little bit, but also I have a thing about nasal spray.
Okay.
Little tip
Share your thing.
from a medical provider, not me, a different one.
Okay.
When you're, and this is just for nasal spray. When you're spraying something in your nose, look at your toes. It rhymes.
Why?
So that it doesn't go down the back of your neck, but it actually goes into your nose and helps your nose.
Like
So
look
all
at
the
your
times I use
toes.
Flonase and I'm like going like this,
You're doing it
you're
wrong.
telling me I'm doing it wrong.
Yep. In a
Like
nice
just
way
with your
possible.
eyes or with your head?
Yeah, just with your head. Just
Your
look
head.
down.
Okay. Cool.
That way you won't taste
I've been
it.
spraying spray up my nose wrong my whole life. Thank you for the correction.
You've been wasting money your whole life now.
I know, man. I
Well,
know.
it's just gonna work better this way.
Yeah.
Then you're not
That is a tip that I will be sure to share. I love when people find out. I love finding out that you've been doing really basic things wrong this whole time. Has anyone ever seen that TED Talk about hand washing?
No.
You're familiar with TED Talks? They're
Yeah.
usually like really smart people up on stage talking about really. Some dude did one all about how to wash your hands.
I thought you said TikTok.
Highly recommend it. No. TED Talk.
I saw one about garbage bags on TikTok. She's like, we've been doing it wrong our entire lives. We're not supposed to like open it and go like this. We're supposed to like open it, put it on, and then push through it. Apparently. I didn't know that.
Yeah, this is way more fun though.
I know.
It scares the cats. Everybody runs. It's
Yeah.
great.
Okay. So the pharynx with a PH. The pharynx is the back of your nose and like the top part of your throat. That's the whole place where like loogies happen. Once you swallow, gulp, you the food that you have swallowed reaches a fork in the road. It has to go in one of two directions. We either head to the stomach, which is where all food wants to go, or we head to the lungs, which would be really freaking bad to have food and drinks and crap like that go spilling into the lungs. So first things first, let's fill this out a little bit more with some more organs. I have added in the respiratory system. So what we see here are two separate tubes that are running right next to each other. On the posterior side, we have the esophagus heading to the stomach. On the anterior side, we have the trachea, the windpipe. Couple of things I want you to notice when you look at this real quick. Notice how the esophagus is a muscular tube, but the trachea is a cartilaginous tube, meaning it is reinforced with rings of cartilage. Yeah? Has anyone ever used a vacuum cleaner before, ever in your life? Have you noticed the vacuum hoses are thick and ribbed? Because the air pressure within that hose changes a lot. So when we start sucking through, the natural tendency of that hose would be to collapse and be flat, and that would render the whole thing pointless. So we intentionally design our hoses with those thick ribbed rings around them to make sure that the hose stays open regardless of what pressure is found inside the hose. Follow me? Do you see where we're going with this? We pick all of our best design tricks from nature, directly from nature. True story. So we have said over and over and over that the pharynx with a PH is the back of your nose and the back of your throat. I will not make the hawk and a loogie sound anymore. You got the one and we're done. But when we start to remove some of this stuff and we look in here, So here is one major piece of the construction. This is called the epiglottic cartilage, which means it is the cartilage of the epiglottis, which is a little flap. So you've got two tubes right next to each other. And this little flap pretty much stays over the stomach hole. So your stomach is pretty much closed off from the body. The airway remains open by default. This changes when you swallow. The act of swallowing contracts special muscles and is far beyond what we need to know exactly how it works. Doesn't really matter to us. The point is, when you swallow, the little flap is flipped over. It closes off the airway, opening up the esophagus, allowing food to pass through. After swallowing is completed, the flap closes back. So, ever had food go down the wrong pipe? Most likely what happened was that the epiglottis just got caught on the piece of food. It's okay. Your respiratory system has really effective means of making sure that stuff gets ejected out of the lungs. Namely, you cough. You cough it all up. Yep. So, whether my anatomy app will do a proper voice box with like vocal folds and stuff like that, honestly is beyond me. I'm not sure.
Move there.
Vestibular ligament.
I have a question.
Yeah.
So does that mean that the little flap has pain sensors? Because obviously when you, like, even when you drink, water goes down the wrong pipe sort of thing, it hurts. Is that your pharynx that's hurting, or is it the flap or the esophagus? What actually is hurting at that point?
Well, first thing I'll say is almost every tissue in the body gets nociceptors. So almost every tissue in the body can register pain and then relay that information back to the brain. The brain usually will interpret the location of the pain as the location of the problem. So if the pain somewhere, like let's say it's the epiglottis, then that's the epiglottis is what is hurting. That is what the brain registers as. Now, when we talk about people's perceptions of pain are also very unique from person to person. So what one person may consider painful, another person may just consider uncomfortable. So but the nerve signal is still the same, right? What's different is that individual's brain's perception of the same signal, that some other brain received the same signal and it thought something different, right? That's what makes brains so cool. So yeah, it's not comfortable for things to go down the wrong pipe. But this is a holdover evolutionarily from, we used to be lobe-finned fishes 120 some odd million years ago. And, nature does not go back to the drawing board. Evolution does not go backwards. Once it's done, it's done. And now everything after that will have that same trend until the trend changes. And there is no evolutionary pressure, right? It's the inefficient design is not stopping babies from being born or stopping women from getting pregnant, right? And from an evolutionary standpoint, if it doesn't kill you in childhood and it doesn't stop you from having more babies, evolution does not care about it. It doesn't. So all those diseases that don't appear until you're like 50, evolution has zero sway over that stuff because you've already survived and you've already reproduced your genes. So whatever happens to you in old age, evolution does not care. Makes no difference. Once you have a kid, evolution is done with you. Now evolution is looking at your kid's kid. Fun stuff. Okay. So we do not need the respiratory system anymore. I'm going to take all that stuff back out. Moving on down.
Oh, I actually saw
You actually saw
a voice box, like a real, like the flaps.
Did you explain the larynx?
Yeah. So when
the larynx is.
Go ahead.
Oh, I'm sorry. Go ahead.
No, Go. She asked the
The
question.
larynx is the voice box. The larynx is the voice box. You've seen guys like with Adam's apples. I don't have one, unfortunately, but you know, guys with Adam's apples, like when they swallow, that little thing moves up and down. You're in the right area. The larynx is the voice box. It is what contains the vocal folds, which we call the vocal cords, but they're really folds.
Like this, Olivia.
Yeah, I watched a really cool documentary that was all about the human body and everything. It was like a National Geographic something or other. But for one of the things they did, they got Steven Tyler from Aerosmith and they stuck a camera down his throat and had him sing.
I've had that
and
done.
They got to see like what Steven Tyler's vocal cords look like when he hits like dream on, dream on, dream on. And you just see his cords just like vibrating like a guitar string or something. It is insane.
I have the
so you
video of
understand, like,
mine.
Really? Cool.
Mhm.
mhm.
I got to see my choir teacher. She's like an opera singer. And we like literally got to see the video of it. It was crazy.
Yeah, vocal cords are nuts, dude. So when you see those cords, when you put them under strain, like high level singing, like Steven Tyler or opera, and you see how these little cords are just vibrating with a lot of force, right? Like the biggest guitar pluck you've ever seen. You understand why, like, if they get damaged, that number one, that's your singing voice, but number two, they can develop scar tissue,
Mhm.
which is singers nodes, right? You're familiar with nodes on your chords. If you've never heard of nodes,
Pitch
watch Pitch
Perfect?
Perfect.
Yes.
Yes.
I
It's like
can't
you know
see.
me.
I know, right? Yeah, it's really cool. And when you go higher, they actually stretch and they kind of
Mhm.
tilt downwards. Like they get so stretched that they go down. The muscles.
That's cool.
It's very cool.
So
Yeah,
David,
I am
when that,
not.
I'm
Go
sorry,
ahead,
go
Alfredo.
ahead.
No. Go ahead.
So when somebody has that damage, that voice box, for example, like the actor Val Kilmer,
hmm
I think he did it because of all the years that he did with smoking and stuff like that. Didn't they have to remove the voice box because of that? Or
I believe so. Which means Val Kilmer, I mean, he can speak, don't get me wrong, but his voice is going to sound very kind of like raspy and almost like a whisper. Like he won't be able to yell. And certainly his acting career is over, right? Because if you can't project emotion through your words, then you can't act. Unless you're Morgan Freeman. Joke, Freeman fans, calm down. Okay. So since all of your organs are kind of stacked, you know, in front of each other, I'm just going to throw away the liver for a second and then bam. So there is the esophagus in green coming down, and then it blends into the stomach. Yeah, there's the stomach. Now, as you look at the stomach, what you'll notice are smooth muscle fibers that are running in various directions. Actually, there are, unless I'm much mistaken, 4 smooth muscle layers of the stomach, which are running in different directions from each other, so that as each layer contracts independently, the stomach can shorten its length, it can shorten or widen its width, and it can generally kind of pinch and blob itself around. That's a technical term, blob itself around. But it's just a really sturdy muscular pouch that is intended to kind of mix the food with digestive juices and all the various other things that the stomach secretes. More on that in just a moment. Also, just a side note, look at the distinct kind of pattern. That's not just my app doing something weird, that weird swirly pattern on the inner wall of the stomach. That is what the stomach looks like. The name of the game here is surface area. Anyone ever eaten tripe before? Tripe, it's delicious. It's delicious. You should try it. It's delicious. But it's cow stomach. And so one side of the tripe, it's like little white pieces of, I don't want to say meat, but it's meat. One side is nice and smooth. That's the outside. The other side has this weird like webby pattern. That's the inside. And that's the stuff that's like mixing the food. So as the stomach churns, it's got little like fins in there to help move stuff around. if you're having a hard time kind of visualizing this, I'll pull up a picture so you can see it. Tripe is, like I said, tripe is cow stomach. It's really good in vegetable soups. It's delicious. It is delicious. Don't knock it till you've tried it.
Looks like coral.
A little bit, but it
Why-
feels like meat. It's soft and
Oh.
pliable.
Okay.
Why is it so delicious? Is it because it's like smooth muscle or something?
Oh, it just tastes good when you season it right and
Okay,
put it in a broth with the right vegetables.
It's just like other meat, other beef.
Yep.
Okay.
Yep. It's good. You should try it. All right. So, esophagus, stomach. This is where a large portion of both the mechanical and chemical digestion is taking place within the stomach. But we're not done at the stomach. Once we leave the stomach, we move on into the small intestine. This is where chemical digestion will continue, and the vast majority of the absorption of nutrients will occur in the small intestine. Large intestine, by the time the food gets to the large intestine, your body has already absorbed most of what valuable nutrition there is to absorb. There is very little nutrition left. What there is a lot of, however, is water, a lot of usable water. So the primary function of the large intestine is to maintain your water balance. It stores the fecal matter, of course, but water balance is its main thing. So the peritoneum is another structure. I hesitate to call it an organ proper. It's more of just a sac that just kind of wraps around all your abdominal organs and just keeps them all together. However, it's a little bit more complicated than that because it wraps around all of the organs, but then the same continuous sac doubles back and wraps closely around each organ, almost like a shrink wrap, right? Those are really like sealed type packages. So if you were to just slice someone open, it wouldn't look like abdominal organs. It would look like just a big, solid, smooth mass sitting in their belly. That is the peritoneum. It is the sac that contains all of the organs, and it makes sure that your organs don't go shuffling position when you fall somewhere or go for a run or anything. You don't want intestines twisting around and getting twisted or anything getting pinched off. That would be really, really bad. Anita.
So if a woman has a C-section, they're cutting through the peritoneum.
All the way through it, yep.
And would you recommend after the doctor has cleared her for massage that you would give abdominal massage gently? Or
not until the incision is healed.
Healed. Okay.
Yeah, as long as there's stitches or anything, I'm not touching it. But once all that stuff is healed and the stitches are gone and everything like that, then yes. Because guys, it's not just the peritoneum, it's 4 layers of abdominal muscle plus the skin, right? The skin that they cut through.
Yeah.
Skin, adipose tissue, 4 layers of muscle, the peritoneum, and then they have to cut into the uterus. And as we saw last week, the wall of the uterus is really freaking thick and muscular.
Yeah.
So it's like 6 different layers of stuff that they have to cut through to do a C-section. They schedule them like they're no big deal. C-sections are major surgery.
Major surgery.
Do not take C-sections lightly. That is a major surgery.
Yeah.
And I was going to ask, for scar tissue massage, cesarean scars can cause knee pain, back pain, all sorts of radiating pain for women.
Yep.
So it should be textbook. And I was a cesarean birth, like I had a cesarean birth, not as a baby, but as a mother. And I still can't feel parts of my stomach. I still like have scar tissue everywhere. So I think every woman cesarean should be getting scar tissue massage because it's an insane amount of scar tissue.
I could not agree with you more. I will also add other complications of C-section scars because the scar tissue penetrates so deeply into the body. It can often become what's the word we say, commingled with other things that occur like fibroids. And so when fibroids start appearing within the scar tissue, the kinds of restrictions that you were describing, they can become much worse and much more painful. Anita, did you have something else to add?
No, that's very helpful. Thank you. My sister
Cool.
did give birth on Wednesday.
Congratulations.
Really early in the morning. She did do C-section though, so.
Do you have a
unfortunately.
nephew, niece?
Baby nephew, that's why the blanket's blue.
Oh, duh. Well, I didn't want to assume
Rip.
anyone's gender, so.
Not. That's probably a good thing, but yeah, his name's Theo Jupiter Cheshire.
Okay. So looking at the peritoneum from the front, you see it's just virtually a sac. As we turn around to the back, you'll see that it's a little more complicated than that because it kind of loops in on itself and it's kind of shrink wrapping the outer layer of all of those other organs that are in there. But effectively, its purpose is to just hold it all together. Good stuff. So because this sac doubles in on itself, we give each layer a name. You have the visceral peritoneum and the parietal peritoneum. The word parietal means wall. So parietal bone, right? They're the walls of the cranium. That's what the word is telling you. So the parietal peritoneum is the outer side, the side that faces the wall, like the cavity wall. The word viscera or visceral refers to organs. So the visceral peritoneum is the side that faces the organs. Good stuff. So the peritoneum is a two-layered serous membrane. Serous membrane means it's two layers and they're lubricated, so they slide past each other. It lines the entire abdominopelvic cavity. All of your abdominal organs are contained within this sac. The visceral layers covers the outside surfaces of your digestive organs. It forms kind of sheets called mesenteries, which attach to the organs of the abdomen. The parietal layer will line the body wall. That's what the name parietal is telling you. And the space between them is filled with lubricating fluid. So as we move food through the GI tract, there are two processes going on. One is voluntary, which you choose to do, that's swallowing. The next is involuntary, which you don't really choose to do, which is peristalsis. And peristalsis may not make a lot of sense when you look at a little picture like this, right? And it just shows there's like, oh, there's arrows and somehow the ball just moves. But think about a tube that can change its own shape, guys. When I say peristalsis, I always go like this. We open up, we pinch, and that pinch pushes the food down the tube. This is peristalsis. It's very fancy. We've also named another structure there called the bolus. The bolus is the ball of food that you just chewed, right? So when you take a bite of food, you chew it, your tongue kind of shapes it into a ball, and then you swallow it. The ball is a bolus. That's it. So through peristalsis, food is propelled through waves of contraction of smooth muscle. Smooth muscle was involuntary, remember. Another type of peristalsis is called segmentation. Segmentation generally happens in the small intestine, where the bolus is broken into smaller pieces. So with peristalsis, we have one contraction, which is moving through the tube and pushing the bolus along. With segmentation, we contract almost like teeth. Notice how the arrows are slightly offset from one row to the next, right? So we've got each bolus isolated, then we crash down on the bolus, which crushes them all. And then we crush down slightly next to what we just did, which breaks the food into smaller and smaller pieces. What we are doing here, guys, is segmenting or breaking up the food that we have swallowed. hence segmentation. Good stuff? Okay. So oral cavity, we said this is where mechanical and chemical digestion takes place. It begins in the mouth. So chewing and saliva kick off the whole process. Digestion has begun before you even swallow the food. The first line of defense against pathogens also lies in the oral cavity. That is what tonsils are for. You've got a lot of really important immune system stuff going on because you have a ring that is leading into the body. So your immune system wants to take a very close look at everything that's passing through this particular doorway. We also have teeth, which are considered accessory organs. They break food into small pieces using mechanical digestion. They grind and tear. We know how teeth work. Moving on. Muscles of mastication. Mastication is your fancy medical word for chewing. The teeth work together with the muscles of mastication to chew the food. Key muscles here, we have the masseter, which is about 2 fingers wide, and it sits right on the angle of the jaw, from the angle and inferior border of the mandible all the way to the zygomatic arch, right there. Its primary job is to elevate the mandible, which is a fancy way of saying close the mouth. It closes your mouth. The next muscle is temporalis. This one sits over the temporal bone. You ever seen a bald guy chewing and you see that muscle way up in his head that's working? That is temporalis. That's what you're seeing. Temporalis inserts on the cornoid process of the mandible. It also elevates the mandible. It is a mouth closer by pulling up on the jaw. The lateral pterygoid is one of the few that opens the jaw. Since gravity kind of assists, you don't really need big, strong muscles to open the jaw. You need big, strong muscles to close the jaw over and over and over again, right? So that tiny, pathetic little lateral pterygoid muscle that's like that freaking big, that is what opens your mouth. There you go. The medial pterygoid also elevates the mandible, closes the mouth. And the buccinator. I don't know if you guys get into face muscles very much, but the buccinator is the one that trumpet players use the most. So when you, that's the buccinator. So when you puff your cheeks out and then tighten your cheeks back in, that's the buccinator muscle. It compresses the cheeks, which assists with chewing. So it's helping you to like form the bolus. The tongue, often cited by anatomy fact enthusiasts as the strongest muscle in the body. That is actually not true. The tongue is not a muscle. The tongue is 8 separate muscles, all working together. So the tongue is not the strongest muscle in the body, not even like relative to size or anything else like that, because it's not one muscle, it's 8 different muscles. In terms of pure power, like what is the strongest muscle in the body? For most people, that would be gluteus maximus. It's flippin' big. However, relative to size, right? If all of your muscles were the same size, it would be your masseter. This guy can close your jaw with 150 pounds of force, which is enough to take a finger off at the knuckle. Like if your teeth slid between the 2 bones, you could bite your finger clean off. The masseter is that strong. Tough little muscle. So, no, the tongue is not the strongest muscle in the body. Sorry. But it does help to position the food on the teeth, right? So you want to make sure that the food stays in the tooth area while it's getting chewed on. It also has sensory receptors for taste, sweet, sour, salty, bitter, and umami, which is like a rich, meaty, earthy flavor. Think about like mushrooms or steak, that kind of stuff is umami. The tongue also assists with articulating speech. And if you have ever suffered from or know someone who has suffered from a speech impediment, oftentimes it's a mistrained tongue where the tongue isn't moving in the right place or hitting the right spot in the mouth to create certain kinds of sounds. This is a very fancy diagram of the tongue. We do not need to know anything else about the tongue other than what it said right there. Cool, cool. Moving on. Salivary glands. Now, this slide will tell you there are 3 pairs of glands that secrete saliva into the mouth. I'm here to tell you we just discovered a 4th pair. They are wrapped around your eustachian tubes, which come down from the ears into the back of the throat. They discovered them doing research in cancer patients. So many people who go through chemotherapy, one of the side effects is chronic dry mouth. And so what they were doing was they were trying to target salivary glands. So they injected them with a dye chemical that just lights up saliva glands, and then they ran them through a scanner, and they found 4 pairs. You've got the 3 that everyone knew about, but there's another pair, 1 on each of your eustachian tubes. So this has been updated. There are 4 pairs, 8 glands total. Cool. Just saying. Just saying. I'm not making a huge deal out of it. I'm just saying. Anatomy is awesome. Saliva secretion is stimulated by parasympathetic nerves. So when we think about what we know about parasympathetic system, right? What does that system do? Rest and digest. So when parasympathetic system is activated, saliva production goes up. Cool. So we have said already, saliva functions to begin chemical digestion in the mouth. Specifically, it begins breaking down carbohydrates and fats. It also lubricates the mouth for swallowing and for speech, and it provides defense through antibodies and proteins. So the pharynx, here we go, extends from the back of the nose down to the esophagus. So usually right about here is where we draw the dotted line. Everything down is now officially esophagus, right? Just up here is the pharynx. It is divided into 3 main regions: the nasopharynx, the nose part, the oropharynx, the mouth part, and the laryngopharynx, the throat part. It is the common passageway for food and air. So this is the piece where food and air are both going through the same tube. We have not yet gotten to the glottis, which is switching us back and forth. During swallowing, the soft palate will block the nasal cavity. So as you swallow, the soft palate rises up, the epiglottis flips over and blocks the trachea, blocking off the windpipe so that food can pass down to the stomach. And you can see here, so the green portion is the glottis, and what you're kind of looking at is that white line up at the top. My pencil's not going to let me draw on this, but right above the green and kind of in front of the purple, you see that little angled line right there. That's the glottis. So normally it's staying open, but when you swallow, it flips closed onto the trachea to block off your windpipe. And then when you're done swallowing, it opens back up. Just a random fun fact. Human design says that food and air go through the same tube, at least right up at the top, right? But some of our other friends do not share our evolutionary line, and therefore they do not have the same one pipe limitation. The one that I'm really thinking about are snakes. Since you think about the anatomy of a snake, if it has to swallow something that is very, very big, how can it do that without blocking off its windpipe? And the answer is their food tube and the air tube are 2 separate tubes. They do not have the same limitation that we do. They have 2 separate tubes. Do you see that little thing that looks like it wants to be that snake's little tongue? That's its windpipe, right at the tip of its mouth. There, this one as well. When you zoom in there, you see that like hole looking thing right at the floor of his mouth? That is their windpipe. That is how they can breathe while also swallowing something like 5 times bigger than their head. But humans and snakes diverged on the evolutionary path way long time ago. That's how you get radically different solutions for the same general problem. Snakes are awesome. Okay, esophagus. Muscular tube extends from the pharynx to the stomach. It carries food through peristalsis after voluntary swallowing. So you choose to swallow first, then everything automatic kicks in. The lower esophageal sphincter keeps food from leaving the stomach. So when we say the word sphincter, what we are talking about is a muscle that is shaped like a ring. So when the muscle contracts, it closes. And when the muscle relaxes, it opens. These are usually made of smooth muscle. Remember, guys, smooth muscle can hold a contraction for like a really long time without getting tired. That's one of the magic of smooth muscle. Now, I will also say there are other names for these things. Welcome to anatomy. Everything has 5 different names. I just forgot what they called it. Lower esophageal sphincter. So the esophagus comes down, there is a sphincter, and then you go into the stomach. Then there is another sphincter, and then you continue on into the small intestine. Okay. Remember where we said the stomach was located? It's right there. So guess what's right above it? The heart, right above the stomach. So the entrance into the stomach, which I'm pointing up here because my camera's weird, but the entrance into the stomach is a sphincter. It is the cardiac sphincter or the lower esophageal sphincter. Either way, you are looking at the muscular ring-shaped entrance into the stomach. Once you are in the stomach, you do not get out until the stomach decides. So you can stay in there anywhere from 10 minutes to 4 hours, sometimes more, depending on what's in there. Not only is the stomach comprised of 4 layers of smooth muscle, like we said, layers and layers of muscle, so the bag can churn and move stuff around, but it is also very elastic. It is very stretchy, and it will stretch to accommodate quite a bit of food. However, it is stretchier when it has been warmed up. So what I mean is, have you ever, for some reason, maybe had to go a while without eating, like you haven't eaten all day, and so you finally go to get dinner and you order just a bunch of food, but you haven't eaten all day and you really can't actually eat all that much food, like you actually eat a really small amount before like you're full? That's what I mean. So then look at, on the other hand, like competitive eaters, right? People who are in like hot dog eating championships or whatever. They practice what they're doing by stretching the stomach. So the reason that you can't eat a whole bunch of calories if you haven't eaten all day is because your stomach has shrunk through lack of use. And so you eat some food, right? And it stretches out, but at a certain point, the stomach is like, whoa, I'm stretched out too much, I'm full. And you only had that much food.
Is that why fancy dinners serve hot soup before a meal to like warm up the stomach?
Partially, yes. Partially.
Maybe.
Also because soup is delicious.
Yeah. But like it has a practical use,
But yes,
I guess.
it warms up the stomach and prepares the stomach by pulling fresh blood and all that kind of stuff. It prepares the stomach for what is about to happen to it, which is it's about to get stretched out. Cool. So my whole point there was I just wanted to point out that there is another name for the lower esophageal sphincter. It is the cardiac sphincter. So since we're talking about this sphincter, now is the right time to talk about GERD, or gastroesophageal reflux disease, right? Heartburn, right? You guys are familiar with GERD, heartburn, acid reflux disease, right? You take Pepcid AC. This is the thing. The problem is with that valve. The problem is with that sphincter. It's become damaged or weakened or whatever. And so a little bit of stomach acid is allowed to backflow up into the esophagus. Now, the stomach is well designed to do what it does. It holds really acidic stuff and it holds it really well. Thank you very much. The esophagus was not meant to hold super acidic stuff. So what happens is, you know, one instance of heartburn is no big deal. Bodies heal, that's what they do. But when you are having acid reflux several times a week, stomach acid will start to erode the inner lining of the esophagus, and that leads to a whole bunch of other problems down the line. Some contributors to esophageal reflux disease, it's often comorbid with obesity. It can sometimes appear during pregnancy. Usually pregnancy-related GERD will subside after the pregnancy subsides. It can also cause delayed stomach emptying, which means you hold on to food in the stomach for way too long, which makes it way too acidic and it gives you a sour stomach. Usually we can relieve GERD symptoms through diet and lifestyle changes, right? Obesity, changing the foods you're eating. Your body may be sensitive to certain foods. Maybe you need to check out the acidity of the foods that you're eating and maybe opt for a slightly more alkaline diet. But long-term exposure to stomach acid in the esophagus will deteriorate the tissues. And when tissues are damaged, they will heal. But when you make a tissue do that over and over and over, and you keep damaging it and it keeps healing, you can get cancer. And that's bad. Good stuff. Yeah. Anita.
I actually knew a guy who was born without the lower esophageal sphincter.
What a bummer.
Yeah, lots of
Yeah.
hard work for him.
Yeah.
But by 25, he had to have a surgery to where they tied his stomach, top of his stomach, around the esophagus and made a sphincter, and now he's much better.
Fascinating. It's almost like lap band surgery.
Yeah, kind of like that. Yeah.
Almost. I mean, it's not the same thing, but it's similar.
Yeah.
So, yeah, GERD, man, heartburn. Take it seriously. Take it seriously. And if it's happening 2 or 3 times a week or more, and this is happening for weeks on end, please go see a doctor. Please go see someone. There's medications you can take. You can change your diet. Like there's ways around it, but you really only get one esophagus, guys. And I promise you will miss it when it's gone.
How does the calcium counteract against that? Like in the Rolaids or the, it seems like it's always calcium that helps it.
Oh, hold on.
Is that like a negative feedback loop where
No, it's just alkaline. It's just alkaline is all it is.
Oh. Lowers the acid or something, and then.
Yep, by introducing alkaline. That's how Alka-Seltzer works.
Yeah,
right? When you've got a really acidic stomach, you add, if you have too much acid, you add a base and the two will neutralize each other.
Okay.
Calcium carbonate is the chief thing. Incidentally, calcium carbonate is the same mineral that mineralizes your bone. Bone is chiefly calcium carbonate and calcium phosphate. But right there, calcium carbonate, 1,000 milligrams, purpose, antacid. It's alkaline. So how does Tums work? And not just Tums, but all of those like Rolaids and all that stuff. It is basic chemistry. If something is too acidic, you add alkaline to it and it will not be acidic anymore. Good stuff. So stomach functions, stores ingested food. It mechanically digests the food to form a creamy fluid, which is called chyme. Chyme. It rhymes with time. Right? It's not chime. It's chyme. So after you have chewed the food into a disgusting paste and then swallowed it into the stomach, your stomach is going to expose it to really, really acidic secretions and also lots of enzymes and other stuff that's going to start chemically breaking the thing down. As the stomach keeps churning and mixing this stuff, it is eventually just kind of being squeezed out. It's kind of the consistency of like loose toothpaste. And the pyloric sphincter will relax and allow a small amount to pass on into the small intestine, and then it closes again. So we allow small amounts to leave the stomach over a period of time. Within the stomach, we also begin the chemical digestion of proteins. And this is really kind of critical since like your whole freaking body is made of protein. So this is an important one to take a note of. Protein digestion begins in the stomach, whereas carbohydrate and fat digestion began in the mouth with the saliva. I would write that down real quick. Another function of the stomach, because it is so gosh darn acidic, it is very few bacteria that can live there. So it kills a lot of the bacteria that are on the food that you eat. And then it propels food into the small intestine. So the stomach makes many secretions, chief of which are its variety of enzymes. So if we don't recall this from Biology 101, enzymes are proteins. That is important, you guys. They are not cells. They're not living things. They are objects. They are constructions of protein that your body puts together. They regulate chemical reactions. They can speed up or slow down or control the rate of chemical reactions. And enzymes are very specific about the kind of reaction that they do. So they're super duper specific. Probably one of the most important ones that the stomach secretes is one called pepsin. Pepsin is an enzyme that begins to break apart proteins. It starts the process of breaking proteins into their constituent parts, which are called amino acids. The stomach also secretes hormones, which will be used to help regulate digestion. So here's a little example here. So we'll start with a stimulus. The stimulus is your eyeballs spotted that piece of steak. You saw food. And so your reptile brain goes into action. Because of that nerve stimulus, right? Nerve from the optic nerve. So you got a nervous system input, which sends a signal through the hypothalamus to the stomach. It starts to prepare the stomach for digestion. So we trigger the secretion of digestive juices. The stomach will start to release a variety of chemicals, lots of enzymes. The one here we're looking at is gastrin. Gastrin promotes the production of stomach acids. So we increase the acidity inside the stomach. Side point real quick. The stomach doesn't contain acid all the time. The stomach contains acid when it's getting ready for food. But once you have digested all the food and everything is gone out of your stomach, all of that other stuff drains away too. The stomach is empty when it's not doing anything. So you're not just holding around a bag of acid all day, every day. Just context. So when we see food, we send a signal to the to the stomach. It activates its stretch receptors, start preparing the stomach to stretch out. It starts releasing gastrin, which triggers the production of stomach acids. Meanwhile, your intestines will start to produce secretin, which is a really cool name, man, and cholecystokinin, which is it's a fat. It helps trigger the metabolism of fats by stimulating the secretion of pancreatic juice and bile. Again, bile is used in the breakdown of fats. That's what bile does. So just because my eyeball saw food, I now have discrete chemical changes that are happening in the stomach and the small intestine and my pancreas and my liver. So 4 organs are all ultimately responding to the food that my eyeball saw. Another one of the secretions of the stomach is hydrochloric acid. This is the famous stomach acid. Yes, that's the one. Hydrochloric acid has a remarkably low pH. If we recall our pH scale, you guys will remember it goes from 1 to 14, right? 1 being more acid, 14 being more basic, with 7 right in the middle being perfectly neutral, like water. Pure hydrochloric acid has a pH of 1. It will strip oil off your driveway. It is crazy acidic. Your stomach does not produce pure hydrochloric acid. So your stomach acid usually sits somewhere around 2. And again, not to get bogged down in details, but if we're talking about the pH scale, so when you think about a graph and you think about something increasing with time, right? What you're seeing here is a linear correlation. That is not how the pH scale works. The pH scale works on a logarithmic curve. Which looks more like that. So my point is a pH of 1 is way, way more acidic than a pH of 2. Follow me? It's not like a simple like up 1 over 1, up 1 over 1. It's not like that. So there is a very big difference when we say a pH of 1 and a pH of 2, or a pH of 2 and a pH of 2.4. Like these are very large differences because we're working on a logarithmic type scale here, just for reference. So when we're talking about low pH, that low pH, that acidity within the stomach activates pepsin, the protein enzyme. It kills bacteria and it helps food digest, right? Because acids, dissolve stuff. So it breaks everything down. Now, you might be thinking, how does your stomach produce something that acidic and then it doesn't just like burn a hole through itself? Like, how have I not like leaked stomach juice all over my school desk? Well, number one, you kind of are. The inner lining is being burned away. But if you think back to how your skin works, right? You've got a bunch of layers on top of each other and the topmost layer is dead. The bottom layer just pushes up as it replicates. Right? So you've just kind of got like a constantly shedding top layer. That is exactly what is going on inside the stomach. The innermost lining, it is actively being eaten away, but it's quickly replaced with a fresh layer from underneath. Also, mucus. Mucus really helps, you guys. So you cover the inner lining of the stomach with a nice mucus coating, and the acid doesn't get through it, so it protects the wall of the stomach. Now, one of the more common errors in this little process are stomach ulcers. We used to strongly correlate ulcers with stress. And everyone would tell you like, oh, if you got ulcers, it's because you're stressed out. That is wrong. Stomach ulcers are a bacterial infection. You have an infection of a bacteria called H. pylori. You need antibiotics. You will be fine. The reason that we correlate them to stress is because generally in times of stress, your immune system becomes impaired. And when your immune system cannot fight infections, infections tend to arise. And that's the ulcer. So the two are correlated, but correlation is not causation, right? Just because the two happen together, one does not cause the other. The two
That's-
just happen together. That's all.
That's so crazy. I had no idea.
Mhm.
Thank you.
So H. pylori is a very, very common bacteria. 60% of the world's adult population has it. It is not that big of a deal. It is very, very common. Antibiotics, you will be fine. It is responsible for most of the peptic ulcers and small intestine ulcers. It is like one of the most responsible strains of bacteria. And it's contracted from poor hygiene and untreated water systems. You can get it through infected water. So what happens with H. pylori is that it invades the wall of the stomach. And when the wall becomes damaged, that wall can no longer produce a mucous membrane. So you end up with a bare patch of wall with no mucus. And that is where the acid takes over. And the acid starts eroding the wall. And it flipping hurts, man. Acid on an open wound, like you ever dropped vinegar in a cut or something like that, that's the inside of your stomach and it hurts really bad. Antibiotics, people. Ulcers can also bleed. So now you're like bleeding into the stomach and now you've got blood loss. So that can be a severe complication depending on how bad the ulcer is. So, all right. Last one for the stomach. Another secretion is called intrinsic factor. I know you raise your eyebrows. Trust me, I know it's weird, but that is the name of this chemical. It is called intrinsic factor. Die mad about it, sorry. The purpose of intrinsic factor is that it aids the body by binding to vitamin B12. B12 is a tricky vitamin to get in. You can't just open up and take it. So we have to use intrinsic factor to bind to it to allow cells to actually take it in and use it. If your body cannot absorb B12 because your stomach doesn't produce intrinsic factor, this can result in various types of anemia, most notably pernicious anemia, which is a deficiency of red blood cells. You don't have red blood cells. Why? Because you need B12 to make blood cells. And if you don't make intrinsic factor, then you can't bind B12. And so no red blood cells for you. Meh. All right. Good stuff from everything we've gone so far. Any questions? All right. Let's take a 10-minute break. Cool. I will see you guys right back here in 10 minutes. All right, everybody, we are back. All right. So next thing we're going to talk about is small intestine. So after the stomach, after the pyloric sphincter, the next portion that we enter is the small intestine. And this is just one super long tube. It is longer than the large intestine. They are named by diameter. So the small intestine is narrower and the large intestine is wider, but the small intestine is usually somewhere about 25 to 30 feet long, whereas the large intestine is usually only around 5 to 7 feet long. The function of the small intestine, this is where most of the chemical digestion is taking place, the chemical breaking down, particularly in the very first portion of the small intestine. 90% of the nutrient and mineral absorption also happens here. So we're actually getting those things into the bloodstream so they can be distributed to the rest of the body. And the name of the game, as in many other places in the body, is all about surface area. So to increase surface area, if you think about the inside of a tube, you could think about something that looks like this. And so the inside of the tube is very smooth and there's not really any friction or barriers or anything to just let stuff pass right through. That would be something like an artery. However, inside the small intestine, what we need is the food to be in contact with the inner surface. So since we need a lot of absorption to happen, we need a lot of surface. So if we go with an option like this, where you just have a one flat, nice, smooth area on the inside, you are actually lowering the surface area. So if you zoom in on the inside of the small intestine, what you will see are small kind of finger-like structures that stick up from the wall. These are called villi, V-I-L-L-I, villi. But the really cool stuff is when you take one of those villi and you zoom into it and you realize it itself is composed of microvilli. So on top of each villus, singular, there are, Jesus, hundreds of thousands, who knows, of tinier little finger-like structures that wrap in 3 dimensions all the way around each one of those little villi. So we have dramatically increased the amount of surface area that is found inside this tube. And again, what you want is all of that chyme to be kind of smeared on the inner wall so that it covers as much surface as possible. And that is the surface that we start pulling nutrients into the bloodstream. So each of these villi, if we were to, again, go way down in there, these guys are replete with blood vessels. We want lots and lots of arteries really, really close to the surface here, so that as all of those nutrients, they will all diffuse into the bloodstream. That's the goal. Now, again, if you were to take the small intestine and let's say you slice it open into like a calamari ring, so you have just one little ring of intestine, the wall of the intestine itself is comprised of 4 layers. I do not know, I don't think we really go into those layers here, but I'll talk about them just to be. So the 4 layers of the small intestine, right, we're talking about from the inner layer, right, on the inside of the tube, all the way through to the outside of the tube. The 4 layers are as follows. The mucosa layer, which is where the mucus is, that's the innermost layer. Beneath that is the submucosa. Then we have the muscular layer. Remember, the small intestine is still engaging in peristalsis, so we need smooth muscle in that tube to keep things moving along. And then the outermost layer is the serous layer. This is the one that will interface with the peritoneum. So from the innermost layer to the outermost layer, mucosa, submucosa, muscular, serous. Or as you notice when in my little brain tricks, when I'm trying to remember these, I just wrote down MSMS. Mucus is in the center because mucus is where all the stuff is happening. All right, that was really fun. So now we've talked about the layers of the walls. Now what we're going to do is take the entire organ, string it out, and realize that this organ is divided into 3 major sections. And the way that I like to remember the 3 major sections is DJ ill. DJ ill, dropping the poops. The duodenum, the jejunum, and the ileum. 3 sections of the small intestine. And those are in order. So the very first part, once you exit the stomach and you are officially in small intestine country, you enter in the state of duodenum. Duodenum. I know the word looks weird. It is not duodenum, it is duodenum. So the duodenum receives chyme from the stomach. It also receives bile and pancreatic enzymes through the pancreatic duct and the common bile duct. But when the liver is making bile and it's stored in the gallbladder will squirt that stuff into the duodenum. That is where it goes in order to be mixed in with the rest of the food. This portion of the small intestine also will produce the hormone cholecystokinin. Cholecystokinin is used for fat and protein digestion. So they just help break down fats and proteins. The second portion is the jejunum. The jejunum is the site of most digestion. That is where most of the actual breaking down goes. All along the way, we've been adding enzymes and stuff to it, right? But enzymes sometimes take time in order to do their jobs. So we've added all of the chemicals. It's this part in the journey where all those chemicals really start to do their job. Finally, we have the ileum, which is the distal end of the organ, and this will continue digestion and absorption. So just more of the same. DJ ill, dropping the poops. Next organ we have is your pancreas. We should pretty much be familiar with this, right? Its biggest claim to fame is insulin. That's what everybody knows it for. So the pancreas lies horizontally posterior to the stomach. So if your stomach sits about here, your pancreas is just a little further back, horizontal. It has both endocrine and exocrine functions. So we'll recall it's secreting stuff both using ducts as well as secreting stuff directly into the bloodstream or into the interstitial fluid. So its endocrine function directly into the bloodstream is all about blood sugar regulation, chiefly insulin. So insulin is released in response to higher levels of blood sugar, and the purpose of insulin is to bind to sugar, have it carried into cells and therefore out of the blood, lowering the blood sugar. Cells cannot just take in sugar, it has to be bound to insulin. So if you cannot produce insulin, you cannot lower your blood sugar. The sugar just stays in the blood, and that is really, really bad. The exocrine function, the function of the pancreas where it is secreting through ducts, involves digestive enzymes that are secreted into the duodenum through the pancreatic duct. So the tube that the pancreas uses is literally called the pancreas tube, the pancreatic duct. It's the tube for pancreatic juice, and that's the technical name, pancreatic juice. Can't make this up, folks. Moving swiftly along, the liver. So the liver is the largest organ in the abdomen. And I often make a point when I'm teaching this stuff because one little word changes the question and the answer. So real quick. What is the largest organ in the body? Somebody tell me, we just said. You guys got to unmute yourselves. I can't hear you.
The liver.
The liver. But the key word is in the body. The liver is the largest internal organ. What if we asked, what is the largest organ of the body? As in the largest organ that you have?
Good.
Is skin. Skin is huge. It's huge and it's heavy. It's way heavier than you think. I watched this dissection video where they dissected a cadaver, and the first thing they did was remove the skin. It was like 22 freaking pounds, and it was big. And this guy had to like haul it over and like put it up on this big thing, and it just like slunked over. It's enormous. Skin is huge. It's huge. It's the largest organ that you have. But the liver is the largest organ in the body, the largest internal organ. It is a minor point, guys, but I just want to call your attention to it, because if you're not paying attention to the word in versus of, you got two different organs, you got two different answers. Just throwing that out there. So, what does the liver do? Well, the short answer is the liver does a hell of a lot. Livers are stupid important to the body, not just for their major function, which is digestive, but the liver is the detoxifier of your body. And this is one of the points where I really go on one of my rants, and I'll keep it brief because I know we're short on time today. Detox cleanses, juice fasts, right? All these like liver detox teas and all this stuff. Listen to me. If you have a healthy, functioning liver, your body is detoxed. That is what the liver does. If you do not have a healthy, functioning liver, I promise you, detox teas or juice cleanses, whatever, that ain't gonna help you. If you do not have a functioning liver, you got much bigger problems than needing some pomegranate fruit tea. Okay? Okay. What you are doing when you pay for those really expensive flushes and cleanses, and you are paying for very expensive pee. All that stuff gets flushed right through your body. The liver detoxifies the body. That is what it does. So you do not need to pay some hippie on Instagram $50 for some shake that's supposed to clear out your liver. Liver does a very good job of clearing itself out. Thank you very much. So, in regards to its digestive function, the primary function of the liver is to produce bile. Bile is a chemical. The liver will produce it, and then it will be stored in the gallbladder. So it just hangs out in the gallbladder until it's needed. The gallbladder's function is to hold it and concentrate the bile. The liver, another one of its major functions, and why you do not need detox teas, it processes blood that is received through the digestive organs, particularly the intestines, through a blood vessel called the hepatic portal. Not super important, but what is important is when your small intestine absorbs all those nutrients, that blood, that super nutrient rich blood, goes to the liver first. And the liver makes sure that it's all clean and there's no toxins in it. And then it goes on into general circulation. The intestines don't have a way of filtering that kind of stuff out. That's not what they do, right? Intestines digest and absorb. We rely on the liver for the detoxification stuff. Liver.
Why is the gallbladder so much smaller than the liver if the gallbladder stores?
Because the liver doesn't produce insane amounts of bile. It only produces a little bit that it would need.
Okay.
So the gallbladder doesn't have to be too big.
Okay. But the liver is Huge.
The liver is the largest internal organ that you
Yeah.
have. And I get that we have a weird sense of like how much space there actually is in your torso, but just for a reference, the liver is on the upper right quadrant. Let me adjust my camera here. Liver is in the upper right quadrant. It is tucked under the ribs. So your liver starts right there. If you find the bottom border of your rib, it's right above that. It extends 3/4 of the way across. So if you draw your midline and now you have your left half, halfway across the left half, that is all liver. It goes 3/4 of the way across your torso. It's freaking huge, man. It's huge. It's like the size of a football, just crammed in there.
And does it need to be like, I don't know, like form for function? You know, like why does it need to be so big? I guess is what I'm asking.
Okay, so why does it need to be so big? I do not have an answer for that. I don't know. But I can give you another cool fact about the liver.
Sure.
The liver is the only organ that will regenerate itself. So if you
Yes, like that myth.
or you have
That
to
myth.
donate a liver, yeah, you don't donate your whole liver. They just take a piece of it, like a lobe of the liver, and they transplant it. And the person who gets that lobe of the liver, they will grow a whole liver.
Yeah, I was thinking of
And
that
the
Greek
lobe-
myth. I can't remember his name, but he gets punished by the gods,
It
and he's
was Prometheus, if I'm not mistaken.
Prometheus. Yes, because he
He
stole the
gave
fire.
Yep, he gave fire
And
to
so then they
humans.
have the
So the
crows eat
vulture,
his liver every day,
that's the
and
one.
then it comes back the next
Yes,
day, and it's just endless
absolutely.
torture.
Yes. Yes.
Sorry, I like that stuff.
Me too. I'm a mythology nut. But you're absolutely right. You're absolutely right. That is, and that's kind of why the liver is so cool. It's because it's the only organ that does that, right? We've talked already, I'm sure, about how brains do not regenerate. If you damage the brain, that's it. It's done. We do not have a way of fixing it. You know, you cut off a finger, right? How many of you guys have a grandpa who's missing a finger? That finger does not grow back, right? Bones don't regenerate like that. They'll heal if they're damaged, but if it's just gone, it's gone, right? Livers regenerate, which is awesome. So because they play such a key role, please take good care of your livers, guys. Watch your alcohol consumption. I'm not saying be a teetotaler. I'm just saying watch your alcohol consumption. Pay attention to things you're putting in your body. If you overtax the liver and you go into some kind of liver failure, it really does not end up pretty. Livers are, I don't know. The name liver sounds kind of gross, but trust me, they are super, super important. So again, when we start looking at symptoms of liver damage and the kinds of things that can go wrong with the liver, you know, it's got a lot of functions. And when you give a person a lot of different jobs to do, you can't be surprised if they make a mistake at one of them, right? If you give a person one job, you got a big explaining to do if you screw it up. If I gave someone 36 different jobs and they screwed one of them up, you got to be a little understanding about that, right? So the liver doesn't just produce bile, but it's also getting all the blood from the freshly, I'm trying to think of how to word this. All the blood that you just pumped full of nutrients from the digestive system, that gets routed to the liver. Make sure there's no toxins or anything like that before it goes on into general circulation. The liver also produces plasma proteins like albumin, clotting factors, lipoproteins, which will go on to, the body uses those things all the time. Lipoproteins are proteins that are linked together with fat molecules. Your body uses them a lot in the nervous system, muscles. Clotting factor, blood clotting factors. And albumin is another thing that's in the blood. I want to say it's also related to a clotting factor, but now that I've said that, I'm doubting myself. Protein produced in the liver, it enters the bloodstream, what helps carry vitamins, enzymes, and proteins. It also helps prevent fluids from leaking out of the bloodstream. Water balance, making sure the blood plasma ratio stays where it's supposed to. So the liver also detoxifies substances, which is a really general way of talking about a really specific and complicated thing. The liver is capable of producing a very wide array of enzymes and other kinds of chemicals to help it aid it in detoxifying the body. And I'll just give you one example, just one example. Alcohol. Any alcoholic drink, when you drink alcohol, it's introduced into the body. Your body cannot metabolize alcohol. Your body cannot get rid of alcohol. So without a liver, you would just stay drunk forever. However, your liver is capable of producing an enzyme. It is called alcohol dehydrogenase. Now, the name is not important. What is important is this is the enzyme that makes alcohol not alcohol anymore. So it basically takes the alcohol molecule and splits it into what is now no longer alcohol and water. And what do you do with all this extra water? We shunt it to the kidneys, they filter and excrete it. That is why once you break the seal, you're peeing all night. Without a liver, you cannot generate alcohol dehydrogenase. Therefore, your body cannot deal with alcohol intoxication. You'll get drunk, and then you stay drunk.
Hey,
so
Dave,
when we say, yeah.
So, is it the liver? You were talking about that. It splits it. That split part that's left over, is that considered the sugar that the liver has processed?
I am not
Because-
exceptionally well versed in biochemistry, so the exact chemical process that is beyond me. I do not know. However,
because alcohol is basically sugar.
yes, it is. It's a fermented sugar.
Mhm.
Alcohol dehydrogenases are a group of dehydrogenase enzymes that occur in many organisms, blah, 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 blah. In humans and many other animals, they serve to break down alcohols, which are otherwise toxic, and they also participate in the generation of useful aldehyde, ketone, or alcohol groups during biosynthesis of various metabolites. In yeast plants and many bacteria, some alcohol dehydrogenases catalyze the opposite reaction as a part of fermentation to ensure a constant supply of NAD. So in yeast, plants, bacteria, the same enzyme is used for fermentation, which creates alcohol. But the liver uses that same enzyme to basically defang alcohol and make it so that the body can metabolize. So again, mechanism of action in humans, we bind the enzyme, binding of the alcohol substrate to zinc. Yeah, and I'm just gonna be real transparent. I'm not a biochemist. I was not a biochemistry major, microbiology major. That was just not my thing. So when I see words like deprotonation of THR4, that I have no idea. That is outside my scope. I trust that they know what they're talking about. So here is the chemical equation. So you've got CH3, CH2, alcohol, plus the enzyme will lead to whatever else that is not alcohol. There you go. That's as technical as I can get. But this allows the consumption of alcoholic beverages, but its evolutionary purpose is probably the breakdown of alcohols that are naturally contained in foods that are produced by bacteria or that are produced in the digestive tract. So, Anita.
So what you were saying, when someone has either a poor producing liver or no liver, or whichever, you're saying that if they drank alcohol, they would stay drunk forever? Is that alcohol poisoning?
Now, alcohol poisoning is when you've ingested more alcohol than the liver can process. And so it's backlogged and it's starting to cause problems because you too much alcohol. That's alcohol poisoning.
Gotcha. Okay.
I'm
suggesting that.
I know that dehydration is a big symptom of excess alcohol, and I don't know. That's more chemistry, so I don't know.
Yeah, because so as a result of splitting alcohol, you've produced something that's kind of toxic. And the way that we have to deal with something that's toxic is to dilute it. So
Yeah.
water is the
Oh,
universal
so your
solvent.
body
Everything will
takes the
dissolve in
water.
water. So your body pulls water
Mm-hmm.
to dilute the toxin, which is the alcohol, and then we shunt it to the kidneys. Well, what
Yeah.
are the kidneys going to do when they get toxins and lots of water? You're going to pee it out.
Yeah. Stay hydrated, guys.
Stay hydrated, guys. Yeah. You want to prolong your night out at the bar? Drink water. Drink water. You
Food.
alternate. Okay, so each time your liver filters alcohol, some of the liver cells die. The liver can develop new cells, but prolonged alcohol misuse, like drinking too much, over many years, can reduce its ability to regenerate. This can result in serious and permanent damage to your liver. Remember, guys, little bits here and there, the body can heal just fine. But when you damage the same spot over and over again, the body will start to heal with scar tissue. And when the liver has become subsumed with scar tissue, that is cirrhosis. Can you drink alcohol with a bad liver?
Wait, can
There
you say
is
that
no
part
safe
one more
amount of
time?
alcohol. What?
Can you say the cirrhosis part one more time?
That's what cirrhosis is a scarring of the liver caused by this. Each time your liver filters alcohol, the liver can develop new cells, but prolonged alcohol misuse over many years can reduce its ability to regenerate. This can result in serious and permanent damage to your liver. One night going out of drinking and you kill a few liver cells, they're replaced by tomorrow. That is not a big deal. Those years in college where you lived for the weekends and got smashed at the frat house or whatever you did in college, your liver can regenerate from those, right? Those aren't the issues. What the issues we're talking about are when you know what time the liquor store opens in the morning and you're there to get yourself through the day. I'm talking about alcoholism, right? Alcoholism. Chronic sustained alcoholism continuously damages the liver. And again, little bits of damage will heal fine. Little bits of damage that are sustained over a long period of time will start to be healed with scar tissue. The subsuming of healthy liver tissue by scar tissue, that is cirrhosis of the liver. That's literally the definition of it. Now, cirrhosis of the liver is very common in alcoholics. However, I do want to make the point that there are many other things besides alcoholism that can cause cirrhosis of the liver. It is not just an alcoholics thing. It's just very common. So the next thing that I said was, can you drink alcohol with a bad liver? And the answer is, there is no safe amount of alcohol for people with any type of alcoholic liver disease. The liver can function normally even when about 80% of it is damaged. However, if people continue to drink alcohol, liver damage progresses and may eventually result in death. Can you drink in moderation? Light to moderate drinking may have favorable effects from a liver standpoint. Before I take that advice to heart, I want to read that study and find out what they define as light to moderate drinking, because what I consider light drinking may not even register on someone else's alcohol scale, right? I'm not a big drinker. I drink maybe 4 times a year. So
But a true
I'm
alcoholic.
probably true. Yeah, right. I'm probably biased. So
But a person that is a true alcoholic, there is no such thing as moderate.
no.
They overdo it and they continue to do until they die. And I've seen plenty of
Unless
people
they change,
die.
unless you can get
yes,
to
unless,
change,
but
and many of them do.
a lot of them do. But unfortunately, those ones that actually just keep on going to the end, it is a very, very, I've seen many of them, and it's a sad place to see somebody that's supposed to be like 35 or 40-year-old man, and he looks older than my father, who is 90,
Mhm.
because that's what it does.
I have watched many people in my family drink themselves to death. It runs in my family. Alcoholism runs in my family. One of the reasons why I don't drink that much, just because I've seen what it happens, you know, and I've seen the end of that story. I'm good. I'm good.
Same here. Like, I'm not trying to cry right now, but same here. It's awful, awful, awful.
No, I'm not a saint, and I'm not saying that I never drink, right? I have liquor in my house, but I bought a bottle of Grey Goose when we moved to Portland, and we moved here in October. We just opened that bottle of Grey Goose like this summer. Like, I bought a bottle of liquor and brought it home, and I went months without even opening it. So when this study says light to moderate drinking, we need way more context about what constitutes light to moderate drinking. I would just say if you were having alcoholic liver disease, you probably should just avoid all alcohol. But okay, pancreas, sugar regulation. No, we were talking about liver. I'd give real money if this PowerPoint would stay on the slide that I left it on instead of jumping me all around. It confuses me. Okay, the liver produces plasma proteins, blood clotting factors, albumin for water balance, lipoproteins. The liver also removes old pathogens like alcohol, old red blood cells. So if the red blood cells are nearing the end of their expiration date, the liver may just go ahead and it removes old hormones. So that all those hormones that were sent out into the blood, the liver is sitting there picking them out, throwing them in the garbage once they've made their way through. And bilirubin. Bilirubin is a compound that is made in, I want to say the kidneys, but don't hold me to that. My point is bilirubin is the chemical that makes your poop brown. That's what that is. You're welcome. Most of the brown color of your poop is the dead red blood cells. So red blood cells are red, but when they die, they kind of turn like a brownish color, and that's what you're seeing is all your dead red blood cells. Liver detoxifies substances, and it stores some vitamins. So some vitamins are capable of being stored in the liver, chiefly your fat-soluble vitamins. Fat-soluble vitamins are vitamin A, D, E, K, and then the minerals that your liver can store is iron. Your liver can store iron. More on vitamins later. We mentioned the gallbladder already. There's really not a whole lot to tell about the gallbladder. It is found underneath the liver. Its function is to store bile. It is a bladder. That's what it does. It stores bile. That's all. It then releases that bile through its cystic duct and into the common bile duct, which empties into the duodenum. So follow me here. Whoops, my anatomy app crashed. Come on, app. There we go. Okay, so pulling that away, the green twiggy things you see, those are the ducts from where the liver is making the bile. It is being transported down the tree into the gallbladder where it is stored. Okay. So, oh, geez. So I'm just trying to like peel off some of these things so we can really see what's what and where is what. So we don't need a stomach. Don't need a large intestine. Here we go. So here's the gallbladder. When the gallbladder needs to release bile, it will transport it through the cystic duct. The cystic duct will join another tube, which is this one here, called the common hepatic duct, common liver duct. All the little tubes in the liver all come through right here, the common hepatic duct. You do not need to know all of these. I'm just illustrating my point, guys. This is the one that is important. The common hepatic duct, the one from the liver, and the cystic duct, the one from the gallbladder, fuse together into one single tube called the common bile duct. It is because the liver and the gallbladder use this duct in common to transport bile. Common bile duct. The common bile duct looks like it's going into the pancreas, but wait, there's more. It is just passing through the pancreas. That is a little exit tube. Eventually, it is going to enter So I have removed the back part of the pancreas. So you are seeing inside the pancreas now. There is the common bile duct, and it is entering this tube. That is the duodenum of the small intestine. So all we've said here was the gallbladder releases bile through the cystic duct, then the common bile duct, and into the duodenum. 1, 2, 3. We are just tracing the path of where the bile goes. As we said, your large intestine's function is all about water balance. So by the time the food gets to the large intestine, your body has already absorbed most of the nutrients. What remains is mostly indigestible plant matter, chiefly cellulose. That's why you see corn in your poops, because the outer shell of corn is made of cellulose and your body can't digest it, so it just passes straight through. That's why there's corn in your poops. Now, you ever eaten corn off the cob or whatever, right? Corn has that, each like kernel of corn has that shell, but then there's all that stuff inside. Your body can digest all that stuff inside. It's just the outer shell made of cellulose. Your body can't do anything with it, so it just passes on through. This is the site where most of those gut flora are, all of those really beneficial bacteria that we're all becoming more aware of when we talk about our microbiome and probiotics and all that fun stuff. This is where all these guys live. So by the time the food gets to them, it's pretty much all the stuff that we've saved for them because we're such great hosts. You know, we took our food, we got our nutrients, and then whatever's left over, there's still a little bit here. We pass that on to the large intestine for our bacterial friends. But the main function of the large intestine is to maintain a water balance. So it does this by absorbing water from the fecal matter. You can see the function of the large intestine most clearly by looking at what happens when the large intestine fails, right? When there's a problem with the large intestine. We say that we are trying to maintain a water balance. You want it to stay equal, but sometimes the large intestine will take out too much water, which leaves the stool hard and dry and compacted. That's constipation. Or we are not taking out anywhere near enough water, which means the stool is very liquid and loose, and that's diarrhea. So the large intestine absorbs water as well as minerals. It also absorbs vitamins that are manufactured by the intestinal bacteria. And this may sound a little weird, but guys, this is the whole reason that we have those bacteria there. They will produce certain chemicals through their normal metabolic processes that for them is a waste product, right? It's toxic in their little bacteria cell, so they have to get it out. To us, that's vitamin K. And we need that for blood clotting and like lots of other things. So here's the trade. We give the bacteria room and board and a little bit of food. Nice environment to reproduce, all the food you can eat, you stay right here. Meanwhile, we will come along with our little litter box scooper and I will scoop up the vitamin K that you leave behind and I will use that. And that's the trade-off, right? So we've got a nice little symbiosis here going on where, unlike a parasite, we are mutually benefiting from each other. We are giving them a place to live and food. And in exchange, they are the goose that laid the golden egg. We just literally pick up their poop and use it. Because to us, it's essential. To them, it is toxic.
It's like oxygen from the trees.
It is exactly like that. It's exactly
and then
like
they
that.
take our CO2.
Mm-hmm. Yep. They take a little bit of the food, and usually what the bacteria are feeding on is stuff that we can't use anyway. So we would literally dump it without them anyway. But we need vitamin K, and we cannot synthesize it on our own. The human body cannot synthesize it on its own. So we have to get it somewhere. This is where our bacterial friends come in. Vitamin K is one, certain B complex vitamins or others. Bacteria are awesome. They're awesome. They really are like the goose that laid the golden egg. And then the other major function is that it stores and it concentrates and it releases feces. That is large intestine. So the large intestine also has several major structures. The entryway into the large intestine is called the cecum. And the doorway to leave the small intestine and enter the large intestine is called the ileocecal valve. It is the valve that connects the ileum and the cecum. Ileocecal valve. So once we enter the cecum, we now have a choice to make. We can either proceed on our journey and head up, or we can take a side, what is that? Not sidestep. What am I talking about? A detour and go down. We can go up or we can go down. If we choose to go up, then we continue on our way through the digestive system. So, anterior view, the cecum is here. Lower right quadrant. Sounding familiar? Anything else we know of is in the lower right quadrant?
Oh gosh, it's slipping my mind. Appendix.
Appendix, that's the one. So there's your cecum. We're going to turn this around to the posterior view. And you'll see this little tail looking thing. What? That guy. That is the appendix. All that ruckus and hullabaloo over this tiny little thing. But the appendix is really freaking important, man. It's not just some little thing that likes to get inflamed from time to time. We store, for lack of a better way to explain it, backup copies of our gut flora in the appendix. So if we have a massive infection or a huge bout of diarrhea and a lot of our bacteria get washed away, we've got thumb drives, we got backups. We can use these little samples to repopulate the gut flora. Also, when people's appendixes become inflamed and they take them out, right, appendectomy, appendicitis, they will cut them open to see what's inside. And it's the weirdest thing that you find inside appendixes. It's indigestible things like cellulose and keratin. We find fingernail bitings. We find bits of peanut shells, like the hard peanut shells, just random debris that your body cannot digest. So they just get stuck. And if they get stuck in the appendix and they start to form irritation, appendicitis.
So would you say in that instance that the appendix is kind of like the liver? It kind of filters out the stuff we can't use? Or maybe not.
It's way, way dumber about it than the liver. Liver is really smart and it can make things to detoxify stuff. Like the liver can do stuff. The appendix is like a filter. It just, if you end up in the appendix, you're there. But the appendix didn't pull you in or try to get you in. The appendix is just there. But a lot of, you'll often hear this referred to as a vestigial organ, like a remnant leftover. But it does still have an important role to play. It's not really vestigial. It does something. It is much more diminished than it used to be, but it does still have a role to play.
It's like a dustpan that like catches the
Yeah,
stuff
just random
from
stuff.
the floor.
Yeah.
I was thinking a sink drain thingy, the
Yes.
thingy that catches all the
Mhm.
food.
Yeah. Sink trap.
That
Sink trap.
it's gross, but yeah.
That's so weird that they find. That's weird.
Like whole fingernails? Nuh-uh.
No, like little pieces that you bite
Okay.
off and swallow.
Mm.
Yeah,
Gross.
not whole fingernails, but just like the little pieces that you bite off.
Still gross.
The appendix is a vestigial organ that no longer serves the evolutionary role of digestion that it plays in herbivores. So it's got a much more important role in herbivores. However, there are suggestions that it serves as a reservoir for beneficial symbiotic bacteria, thumb drives, in case you need a backup copy, enabling recolonization of the colon if the normal microbiota is lost. It saves a bacterial thumb drive backup copy, which is just awesome. I mean, that's cool. I don't care who you are. That's awesome right there. So next up, cecum, ileocecal valve, vermiform appendix. All these guys are down here in the bottom. Vermiform is often added to it. It's appendix, vermiform, same thing. Now, the rest of the large intestine is labeled as follows. If we were to not detour to the appendix, but instead we continue on our regular road, when you pass through the ileocecal valve into the cecum, we turn up and head through the ascending colon. Ascending, the rising colon. Very important. This is on your right side. The layout of a large intestine is the way it is. We always start on the right hip. The ascending colon goes up the right side. Then somewhere around the rib, when you get to the lower part of the ribs, we then take a 90-degree turn and head transversely across the body. This is the transverse colon. It cuts, there's my ribs, it usually cuts right about there. Then we take a 90-degree downward turn down the left side in the descending colon. It always goes down the left side. Next, we have the S-shaped portion, which is actually snaking across the ilium bone, right? Down towards the pelvic inlet. That is the sigmoid colon. And you just think the sigmoid is like slippery like a snake. When you isolate it by itself, it's just this little S-shaped portion.
Could I see it with the hip bone, the coxa? Oh, okay, so it kind of like, yeah.
And it looks like there's a lot of space between the intestine and the bone, but remember there's muscles there too. Iliacus, psoas major, and the peritoneum has been hidden. So there's lots of other stuff. I'm just saying. It looks like there's a lot of empty space. There are no empty spaces in the body. Everything is packed in. The only thing that has an empty space is lungs when you breathe in and gas. Everything else is packed in. So, all right. I'm going to get rid of some of the small intestine so we can see the large intestine. There we have the sigmoid colon. The final 6 to 8 inches or so of this organ is the rectum, and the rectum terminates in the anus, which is another sphincter. So let's catch ourselves up. We've got the cecum, which is the entryway into the large intestine. That is the lobby that you enter into. You can either head down to the appendix, which is the point of no return. If you go down to the appendix, you do not come back. So instead, we will continue upwards along the ascending colon, then transverse, descending, sigmoid, rectum. Good stuff. Cool beans.
So, quick question.
Mhm.
The large intestine, why is it sometimes called the large intestine and why is it sometimes called the colon? And what's the difference?
There is no difference. They are two names for the exact same organ.
Oh, anatomy, physiology. Okay. Yeah.
Darn you, Greeks!
Thank you.
Yeah, no. So when we talk about something like colon cancer, right? Colon cancer could occur anywhere in the colon. When we talk about colorectal cancer, we are specifically talking about cancer in the rectum, which is a portion of the colon, hence colorectal cancer. So the rectum is comprised of the last 6 inches or so of the GI tract. It opens to the outside world via the anus, which is controlled by sphincters. There is an involuntary internal sphincter and a voluntary external sphincter. And the external sphincter is the one that you're learning to train when you get potty trained. Like you're learning to control. There you go. So feces. Fecal matter is primarily cellulose from undigested or undigestible plant matter. Slopped off epithelial cells. So just you think about all the little cells on the inside of your cheek, when they die, where do they go? You swallow them. Well, now they're in the digestive tract, so they just pass on through, all the way through, if you know what I mean. Your epithelial cells from the inner lining of the entire digestive tract, you've got inorganic material, random crap that you swallowed. Could be bacteria, water, as well as fat and fat derivatives, like byproducts of metabolizing fats. And again, this is where your gut bacteria live. The large intestine is where the whole microbiome is really kind of centered around. And these bacteria will enter your system either through the anus or through the ileum. So when you think about the large intestine, guys, I can either enter through the ileocecal valve coming from the small intestine or the anus. I really don't have a lot of different ways to get into the large intestine. So these bacteria, we said these are good guys. We want them here. Your body actively cultivates them, right? Like a garden to create the right conditions for these guys to come in. The reason is because they make vitamins that we cannot make ourselves, that we need. Vitamin K, vitamin B. They also will ferment cellulose and other indigestible substances. So some of that cellulose that you ate, they can eat it and they can break some of that stuff down. But as a byproduct, they produce gas. And that's where flatulence comes from. All your gas is actually just all your collected bacteria's gas. So there's a little spiel here about how intestinal flora affects your health. The microbiome is very, very important. However, I have like 40 minutes left. I really need to move along. So we're just gonna. Okay. Defecating occurs by simultaneous smooth muscle contraction over a very large area. The defecation reflex is stimulated by the distension of the rectum. Distension is a very fancy medical word. It means the wall got stretched out. So when the proprioceptor nerve endings in the wall of the rectum tell the brain that the wall has become engorged, meaning it got full of something, time to poop. Parasympathetic nerves. Parasympathetic nerves will open the internal anal sphincter. The internal sphincter is the one that is involuntary. That is the one where you're like, ooh, I gotta poop. That's that feeling. The external sphincter is under voluntary control. That's what you learned how to control when you were being potty trained, right? That and diapers and other, that's what that was all about. You will never control the internal sphincter. It is autonomic. The external sphincter you should have mastered by the time you're 4, hopefully. Parasympathetic nervous system will stimulate digestive secretions. We've mentioned this earlier, right? Parasympathetic is rest and digest. So, wow, and there's your pooping reflex in case you were curious. All right, moving swiftly along. So the next thing we are going to look at is how the digestive system is controlled and regulated. What kinds of things have a say in the process of digestion? Your first answer should almost always be nervous system. Nervous system has its fingers in all the pots on the stove. So nervous system for sure. Chemoreceptors and stretch receptors can initiate reflex arcs within the digestive tract. And we've got, again, that same diagram from the last few slides ago that we saw. But the autonomic nervous system influences the smooth muscle contraction. It activates peristalsis, as well as triggers the secretion of all of those juices and fluids and bile and all that crap that the body has to make just to get through the digestive process. Many hormones are released to control digestion. Probably 2 of the most famous would be insulin and glucagon, right? But we also have local chemicals that are secreted by the digestive tract that influence nearby cells. So they don't go on to have effects out in the body, they just have effects in their little local community. So another process that we have to control is our regulation of food intake, right? You go through cycles of where you're hungry, and then so you eat, and then you're not hungry anymore. And so you stop eating until you get hungry again, right? And you're on this like up and down cycle. The main control center for this whole process is the hypothalamus, right in the center of the brain. Within the hypothalamus, there's the feeding center. It's not my name, that's what they call it. When this area of the hypothalamus is stimulated, it will increase your food intake by making you hungrier. It is stimulated by low blood glucose, so low blood sugar. When your blood sugar gets low, it is usually because you are hungry. So when you get hungry, it stimulates this part of the brain that tells the body, prepare for food because you're hungry. We have, it is stimulated by low blood sugar, and it is inhibited by the release of a hormone called leptin. Leptin is released by fat cells, but leptin helps kind of turn down the hunger. Now, the feeding center is all about getting you ready to eat. The satiety center is all about feeling full and stopping you eating, right? So satiety refers to the act of being sated, S-A-T-E-D, sated. Sated is like when you have an appetite that has been quenched, for lack of a better term. So when we talk about satiety, it's what we're getting at is you feel full, like no longer hungry. So in the hypothalamus, when the satiety center is stimulated, it will decrease your food intake. It is stimulated by high blood glucose, which usually means you just ate. So once you've just eaten, we now turn off the thing that tells you to keep eating. High blood glucose, high blood amino acids. So lots of amino acids, ergo protein in the blood. Leptin, insulin. The presence of these kinds of things triggers the hypothalamus. We have just eaten, we need to reduce our food intake. Good stuff? Everybody, good stuff? Cool. Now, as with every other organ system in the human body, they all tend to kind of fail as we age, each in their own unique ways. But the digestive system is no exception. As we age, the parts start to wear out, and we start to have more and more difficulties with basic digestion. The body will start to produce fewer digestive juices, which means that the act of chemical digestion becomes that much more difficult for the body. In elderly people, generally the kinds of food items that give them the worst digestive trouble are raw fruits and vegetables. Particularly like the cruciferous vegetables like spinach and kale and lettuce and things like green leafy stuff. This is why a lot of elderly people can't eat a lot of salads, because it tears their stomach up. They're not producing enough enzyme to digest fruits and vegetables. It gives them gas, like bloating and stuff like that. Also, think about the villi. Remember all those little micro villi? After, 6 decades of doing their job, those guys get damaged. And when those guys get damaged, it reduces the surface area that is available for absorption. And when you reduce the surface area, absorption becomes less efficient. So not only are we not able to actually digest some of our food, but even once we digest it, we can't absorb the nutrients properly. Because again, those microvilli have been damaged just over time, just from age. And the muscular activity of peristalsis will start to slow. So you may notice like sluggish bowel movements. You're not really regular anymore just because you turn 60, ain't no one in a hurry. So the body will take a little bit longer moving stuff on through. Now there are massage techniques that we can use to aid the digestive system. Most famously is the massage technique for constipation. And since we talked about where the large intestine sits, right, and it starts near your right hip and it goes up and over and down towards your left hip, you will understand when I say you must perform this technique the way it is shown to you here. You cannot do it backwards. You must go clockwise around the abdomen. If you go counterclockwise, you will constipate your client, and that is rude. All right, good stuff. Any questions? All right. This next topic that we're going to move into is about nutrients and nutrition. Ironically, this is one that I actually know a little bit about, which is just more of a negative for me because I don't have time to explain everything that I really want to explain. So let's start with the big one, metabolism. Metabolism is a really big word. The word metabolism covers all of the chemical reactions that take place in the body. That's a lot, like tens of thousands of chemical reactions per cell, per second. Tons of stuff is going on. So just understand, guys, the word metabolism is a very general word. It's a very vague word, right? It doesn't mean any one particular thing. It's the amalgamation of all of these different reactions that are happening all the time in every cell of your body. Now, the process of metabolism is divided into 2 main phases. We have the catabolic phase and the anabolic phase. To put these 2 in context, since we just talked about the digestive system, think about going to a fast food place for lunch and you buy a cheeseburger. And you sit down at your table and you're looking at this cheeseburger in your hand and you think to yourself, what can my body do with this cheeseburger? Can my body use this cheeseburger as it is right now? No, it's way too big, right? So first things first, I can't even fit it in my body. First things first, I gotta like break it into pieces and get them in there somehow. Gotta chew, gotta swallow. But then the bread has to be pulled apart molecularly into the constituent sugars that make up those carbohydrates. The Meat patties have to be broken down, right? Those are proteins, but they've got to be broken down into their individual amino acids, something that our body can absorb and utilize. Same thing with the fat in the mayonnaise or the fat in the meat. The fat has to be broken down into fatty acids before our body can use those elements. This is the catabolic phase of metabolism. Catabolism is breaking down large molecules, like your cheeseburger, into smaller molecules, their component pieces, which is something that is readily absorbable by the body and usable. Now, the second phase is, okay, so cool. Once your cells get the food and the oxygen and the nutrients, what do they do then, right? This is the anabolic phase. What do? They grow, they develop, right? They heal, they regenerate. That is the anabolic phase. Anabolism is synthesizing larger molecules from smaller ones. So if catabolism was taking my cheeseburger and breaking it down into little pieces, anabolism is taking those little pieces and putting them back together in a new way, not the original cheeseburger, but a new way that my body can use. Ta-da! Metabolism. So, more specifically, catabolism refers to chemical reactions that break apart large molecules into smaller ones. When you break chemical bonds, you release energy. The anabolic phase are chemical reactions that build large molecules from smaller ones. In order to stick two molecules together, you have to spend energy. It costs energy to stick stuff together. You release that energy when you break them apart, okay? One little side note that I just want to make sure that we're clear on. Anabolism and catabolism, although they are two distinct processes, they are both happening together in every cell all the time. Your cells do not punch a card and switch to anabolic mode, and then suddenly at noon we clock out for lunch and then come back and now we're in catabolic mode. Your cells are doing everything all the time at the same time. Welcome to the life of a cell. Also, little trick to remember these guys. This is just what works in my brain. When I think of catabolism, right, taking a large molecule and breaking it down into smaller pieces, I think a catabolism is a catastrophe because you're breaking it apart. For anabolism, you guys ever heard of anabolic steroids? Is what those bodybuilders use illegally to make themselves like super duper crazy muscular. Anabolic steroids hijack the process whereby cells go through their anabolic phase. When they build up, anabolic steroids accelerate that process, so you build up a lot faster. That is why they do the steroids, because you grow muscle that much faster. Nice little bit of context there. Anabolic steroids building up. Catabolism, like a catastrophe, breaking everything down. Okay, so before we jump into whatever the heck this PowerPoint is about to talk about, nutrition. Every food that you eat, whether it is candy or really good, healthy, whole foods, whatever, we generally break all nutrients down into two main categories. Two. Macronutrients, which are big ones, and micronutrients, which are little ones. What do we mean by that? What we mean is, for macronutrients, I require a lot of them, like pounds of them every day. That's the food that you eat. Micronutrients, you only require in very, very small amounts. There are 3 macronutrients. Carbs, fats, proteins. Now, carbohydrates can be broken down into 2 subtypes, right? But first, I want to talk to you guys about what a carbohydrate is. All carbs are sugar. All carbohydrates will be broken down into sugar. The question is, how many chemical processes does it take for me to get there? Because some carbohydrate molecules are extremely long. It's a really long molecule. So it takes the body a while to break it down into several pieces that are then usable. We call these complex carbohydrates. These are the things that sit at the bottom of our food pyramid: bread, rice, pasta, cereal, grains. Simple carbohydrates are a lot simpler. They are not long chain molecules. Simple carbohydrates are small molecules, maybe 2 or 3 little sugars stuck together. Simple carbohydrates are the ones that you see at the very tippy top of the food pyramid, right? The refined sugar, candy, sweets, that kind of stuff. One more side note, complex carbs go by another name, and that is starch. So your starches, potatoes, yams, that kind of stuff. Fats must be broken down into their component parts. Fats are broken down into fatty acids. And proteins. Welcome to anatomy. Everything has 5 different names. I'm very sorry about your life, but protein. So proteins go by a lot of different names. We can call proteins proteins, which is what I prefer to do. We can also call them polypeptides, which are multiple chains of proteins. We also have peptides, which are just chains of proteins, no multiples, just the one chain, peptide. And then you will also sometimes hear them called polyamino acids, which are many amino acids. Guys, all proteins break down into amino acids. There are 21 amino acids, full stop, period. There are 21 of them. Every protein in your body is made of some combination of those 21. Now, for our purposes, we do not need to know the names of all of our amino acids. That is just well outside our scope of practice. But I do just want to just give you some names so that maybe that biology class you took 7 years ago, you'll be like, oh, that's what that, okay, I'm with you. But amino acids go by names like phenylalanine, lysine, glycine, tryptophan. Tryptophan is the one that's in turkey. It makes you sleepy on Thanksgiving. Leucine, really good for your eyes. Cysteine, tyrosine, glutamine. Glutamine. Glutamine is one of the ingredients in MSG, right? You know, that stuff that they allegedly put in Chinese food is supposed to be all bad for you, but it really didn't do anything wrong. MSG, monosodium glutamate. It is one glutamate amino acid bound to a sodium ion. It makes everything taste really good. It also gives some people headaches. So I went through this long spiel. Carbs all break down into sugars. You can have complex carbs or simple carbs. Fats break down to fatty acids. Proteins break down into amino acids. Cool? Cool. Now, for your micronutrients, the ones that you only require trace amounts of every day, those are your vitamins and minerals. Vitamin A, vitamin B, vitamin C, vitamin K, niacin, copper, zinc, iron, calcium. So vitamins are usually named with a letter: vitamin A, vitamin B, vitamin C. Minerals you will recognize from the periodic table. These are actual like elements out there, right? Like copper and zinc. Your body requires very, very tiny amounts of these things, but they're really freaking important for your body. One good example, iron in your blood. You need a minuscule amount of iron, but your blood will not function without it. So when we look at carbohydrates, as I said, carbohydrates are all sugar. All carbs rhyme with sugar. The thing is, not all sugars are created equal, right? So carbohydrates contain sugars and starches. Starches are just really long chain sugars. Because their molecules are really long chains, your body has to spend more time and effort, meaning energy, into breaking those molecules apart. So when we look at blood sugar and how blood sugar responds, when you just dump straight up simple sugar, which is readily accessible by the body, you get a blood sugar spike. And then the pancreas responds by releasing insulin. The insulin binds to the sugar and it's carried into all the cells, so your blood sugar level drops. So you had a blood sugar spike. The more desirable outcome is you want the body to take a little bit more time breaking that sugar down. If you introduce a complex carbohydrate, then your blood sugar will slowly rise before falling again. So you see a slow, gradual rise in blood sugar rather than the spike, which will inevitably lead to a crash. And that is why we all get tired at 2 in the afternoon. So carbs contain sugars and starches. They are primarily used as a source of glucose, which is for energy. So glucose is all around the body's favorite sugar. Anytime the body gets other kinds of sugar, it tends to convert them into glucose. Your body can use other kinds of sugar, but glucose is every single living cell in your body knows how to use glucose. The knowledge of how to extract chemical energy from that particular sugar is ancient. I mean, it's as old as life itself. So every cell in your body knows how to use glucose. So when you are exposed to other types of sugars like galactose or lactose, the body will generally try to convert that back into glucose. And that's what the sugar it's going to use. So carbohydrates also provide fiber in the diet. Fiber, again, we're talking about cellulose, that undigestible bulk of your fecal matter. You want that stuff because as that ball of poop runs through your system, it's wiping the walls, taking all the junk with it. It's cleaning out. You need fiber to bulk up your stool so that it promotes healthy defecation. This is why old people are always yelling about the Metamucil, right? And how they need fiber because you need fiber to give yourself regularity. Now, monosaccharides, which are single sugars, monosaccharides. So you are looking at a single molecule of glucose or something along those lines. These guys provide building blocks for nucleic acids as well as glycoproteins. Glycoproteins are used all over the body, but nucleic acids, guys, that's DNA. That's DNA and RNA. That's like the instruction manual for how your cells cell. You know what I mean? So when we talk about monosaccharides kind of being important, they're like the skeleton of your DNA. They're kind of important. The chemical digestion of carbohydrates begins in the mouth with saliva, specifically the enzyme that is known as amylase, A-M-Y-L-A-S-E, amylase. Amylase, listen to me carefully. Amylase begins chemical digestion of carbohydrates in the mouth. Did everybody hear what I just said? Amylase begins chemical digestion of carbohydrates in the mouth. That process will then continue on into the small intestine. Carbohydrates are absorbed in the small intestine as monosaccharides. Your body will break them down into individual sugar molecules. So here's what this looks like. We begin with a starch, a very large, very compacted molecule of sugars. Amylase begins breaking off pieces of the starch. What we are left with are these little pairs, right? These little pairs, that's maltose, another sugar. But your body doesn't really like maltose. I mean, it's all right. That's not the best. The best is glucose. Glucose. Quick and it's cheap, and everyone knows how to use it. So we use amylase in the mouth to break starch down into maltose. We use amylase again to break down that maltose in the small intestine. And then by the time we reach the end of the small intestine, we use a new enzyme called maltase. Maltase splits maltose, the sugar, from pairs into singles. Those singles are glucose. Ta-da! Now, that was really fun. This is what I want you guys to know. The chemical digestion of carbohydrates begins with amylase in the mouth. Everybody clear on what I'm trying to tell you here? So, most of those monosaccharides that your liver will encounter, the liver will convert them into glucose. That is what the liver does. If the liver has, well, I'm not there yet. Glucose is then carried through the bloodstream. So the sugar goes into the blood, that is your blood sugar. Blood glucose enters the cells through facilitated diffusion. When we say facilitated diffusion, it is facilitated by insulin. Sugar cannot just walk into a cell, just like you cannot just walk into a government building. You need to show some ID, or you need to be with someone who has ID, right? Sugar cannot just walk into a cell. It must be accompanied by insulin. So without insulin, the blood sugar never lowers. The sugar never goes into a cell. It just stays in the bloodstream. That's diabetes. This chart here, very fancy, very informative, does not pertain to us. Nothing I want you to worry about, okay? So, like we said, the body will always prefer glucose. That is its default. However, if you have ever had to deal with something like, I don't know, Kool-Aid packets in your pantry where they're flipping everywhere, and you got to go collect all these little packets and stack them up nice and neat and put them in a little container, and just all these things that are everywhere, I just want to put them all in one little place so they're together. What you want to do is store them, right? So the liver is really good at producing glucose. It's really good at making sugar. What it's also really good at is storing that sugar. And the way that it does this is by basically taking a really large amount of glucose, binds them together, and just wraps them all together. And when you have bound a whole bunch of glucose, you have a new molecule called glycogen. Glycogen, in your mind, I want you to think about this. Glycogen is like a shelf-stable form of glucose. I can stick it on a shelf and I can leave it there for years, and it will just stay there. It will not rot. It will not go bad. Glucose, just free in the blood, it's not going to last very long, right? So if I need to store this long term, the glucose must be converted into glycogen. This takes place in the liver. Once we have made glycogen, now we need to store the glycogen. It is most often stored in the liver and skeletal muscles. But every cell gets a little bit. Every cell gets a little bit of it, but it's chiefly found in livers and skeletal muscle cells.
Hey, Dave,
Yeah,
the glycogen that's formed and it's stored, what is that used for? Like, for example,
it is being stored. That's all it does. When the
okay,
body needs sugar, we convert glycogen back into glucose. And now I have sugar again. And now I can, and it's released into the bloodstream. Yep. So the glycogen, it doesn't do anything. It sits on a shelf until we need it. And then when we need it, we turn it back into sugar. Yeah, that's why I say it's just shelf stable glucose is all. That's what it is. It just sits on a shelf, nice and pretty. So to make glycogen, we talked about it, right? It happens in the liver. We convert sugar. It's stimulated by insulin. So again, when you got a lot of insulin, because you got a lot of blood sugar, what do we do with all that extra sugar? We package it and stick it on a shelf. We store it for later. That is a way of lowering blood sugar. To make lipids or fats, the body forms triglycerides from glucose, and this happens in the liver and in fat cells. So you guys have heard of triglycerides before, probably. You know, it's something to do with fat and something to do with, like, I got to check my triglycerides when I get like 40 or something like that, like some vague idea that it's some blood test that I need to have in the future. Triglycerides are the skeleton of fat molecules. So they're the blocks upon which the rest of the fat molecule is built. They are made from glucose. So again, you can't really get away from this particular sugar. Again, the production of fat is stimulated by insulin. And when needed, the liver can convert glucose, the sugar, into non-essential amino acids. So we can also turn sugar into fat, and we can turn sugar into the building blocks of protein. So do you guys understand why your body craves sugar over almost everything else? Your body can use sugar to make more sugar and fats and the building blocks of protein, which is all three of your macronutrients. That is why your body is evolutionarily geared towards consuming as much sugar as you can fit in your face. The problem was, our ancestors, sugar did not exist in the wild other than in like fruits. And sugar in fruits is bound up with all that fiber, so you don't get a blood sugar spike. You get one of those slow blood sugar like humps, right? But nowadays, our fruits have been genetically engineered to be way sweeter than the originals. And even then, we don't even eat fruit. We just put sugar straight on top of carbs and then just chug Red Bulls and coffee all day. Like, we just consume nothing but insane amounts of sugar. The average human being by the time we're 15, we have eaten more sugar than our ancestors ate in a lifetime. Like, we are way overdoing it with sugar. The problem is your body is designed to seek out sugar. It craves it because it's so useful. Our problem is we've made sugar overly abundant, and your body does not know the difference. The body assumes that we are living in a famine time, and when you get sugar, you eat all the sugar. So this is why sugar is so important to the body. This is why the body craves it, because we can use sugar to make all the other nutrients, right? The non-essential amino acids, fatty acids, and other forms of sugar. So when we take in food, we'll kind of follow this little flow chart here. When we take in food, it's first going to be broken down into the three macronutrients. We have proteins, carbs, and triglycerides. Those are fats. Another thing, these teal colored arrows, those are catabolic reactions. So we are breaking down as we move down this chart. So proteins, carbs, fats. Now the carbs, the sugars, some of those are going to be converted into glycogen for storage. That happens in the liver. The proteins get broken down to amino acids. The glucose gets broken down for energy production, chiefly making ATP. And the triglycerides are broken down into glycerol and fatty acids. So the green arrows are indicating anabolic reactions, where we're combining things and building up larger molecules. So we'll pop back over to the amino acids. When the body has an array of different amino acids, it can put them together in unique patterns, which will create specific proteins. Literally, proteins look like that. They're just weird little squiggles, but their actual shape is very important. That's what gives proteins all their qualities, is their actual three-dimensional shape. Just like what makes your key unlock your door is the physical shape of your key, right? If you cut one of the little knobs off your key, it won't work anymore. If you damage a protein, it will not work anymore. It's based on its shape. So now that I've broken down the ingredients in my cheeseburger, now I've got all these different amino acids, and the body can recombine these acids in interesting ways to synthesize new proteins. New protein that did not exist in the body beforehand. We have just created it from scratch. Cool stuff, right? Now, this is where another tricky word with nutrition comes into play. So I just want to make take a real quick second to talk about this. When we talk about amino acids or any nutrients for that matter, you may have heard certain things called essential nutrients, right? Like these are essential amino acids, or this is an essential vitamin. Essential doesn't mean that it's really important. In nutrition, when we say it's essential, what we mean is your body cannot synthesize it on its own. It must be obtained through your diet. So some amino acids are essential, meaning the human body cannot synthesize about 9 amino acids. You must get them from your diet. Now, which amino acids are essential and which ones, you do not need to know that. That is not anything that it's not on your test, but there are your 9 essential amino acids: histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan, and valine. These are the amino acids you cannot make on your own. You've got to get them through your diet. You may have heard of a couple of these before. Leucine is found in tomatoes. It's really good for your eyes. Phenylalanine is used in an artificial sweetener called aspartame. That's what's in Diet Coke and stuff like that. And tryptophan is the amino acid. It's found in turkey. That's why Thanksgiving turkey makes you sleepy. Anita.
All I can think of is Jurassic Park.
Yes. Yes.
Lysine.
Yep. That's it.
Awesome.
So
they're dinosaurs.
When we say, yeah. So when we say essential amino acids, I just want you guys to understand what we're talking about. We're just talking about amino acids that the human body cannot produce. We must get them from our diet. Same thing with all of the other essential nutrients. Your body cannot make iron. It cannot make copper, right? Heavy elements are forged in supernova explosions. Your human anatomy cannot just synthesize iron. That's not how it works. We got to get that stuff from our diet. So how do you get iron in your diet? Red meat. All right. We looked at proteins. Let's look at fats. The glycerol and fatty acids, now that we've got the little pieces, we are going to use our anabolic phase and build them back together. Lipid synthesis and storage. We are synthesizing fats and storing them for later. When that stored fat gets broken down, what you are seeing, right, this little other process over here, the breakdown of stored fat, that's weight loss. I'm gonna pop back over here. When your body, so you got the protein synthesis, your body has made new proteins. When your body starts to digest those proteins that you have just made, that is self-cannibalization of muscle tissue. That is what your body does when it is starving. So if your body begins to starve, you will start to digest muscle tissue to make energy. So next, we've got our carbohydrates, which are all broken down and in some way transformed into glucose. The ultimate goal is glucose. Glucose is used in energy production, namely the conversion of adenosine diphosphate, ADP, into ATP, adenosine triphosphate. I know when you guys did muscular system and you talk about the chemistry of muscle contractions, you probably talked about this, right? ATP and ADP, old news. Good, good, good. All right. I am out of time, my friends. I have 10 slides to go. Okay, everybody grab a pen, take some notes really quick. Cellular respiration takes place, wait for it, in the cell. That is why it is cellular respiration. Cellular respiration is the process that cells use to make energy. This can be done either with oxygen or without oxygen. Whenever possible, we prefer to do it with oxygen. Thank you very much. The reason is because of efficiency. When you go through aerobic respiration or the Krebs cycle, you guys remember the Krebs cycle, right? That chemistry thing, it's like 17 freaking steps long. We don't need to know any of it. What you need to know is when you go through a round of the Krebs cycle, you produce 36 moles of ATP, 36 ATPs from one round of the Krebs cycle. Without oxygen, if you have to use anaerobic respiration, which takes place in the cytoplasm, not the mitochondria, 2. You make 2 instead of 32. So we see why mitochondria are super important, right? Why they're the powerhouse of the cell and why we really, really want to keep them around. But what we also see is cells work way more efficiently in the presence of oxygen. So when you start exercising and pushing your body, right? When you start to run short of breath and you start to sweat and your heart rate is increasing, like in the midst of exercise, you are now in anaerobic mode. Since you're only producing 2 ATP for every round, this is why you cannot exercise indefinitely. At some point, you will run out of energy. That is muscle fatigue. You ever seen those big, burly, muscly guys overdo it at the gym and they're like belly crawling out to their cars because like their legs don't work anymore? They've like literally fatigued their muscles. Yeah. Okay. Glycogenolysis. The ending of this word, glycogenolysis, the ending lysis means a tearing or a breaking, right? We're breaking something apart. What are we breaking apart? Glycogen. Glycogenolysis or glycogenolysis is converting glycogen into glucose, usable glucose. We take glycogen from the liver and from skeletal muscles, we convert it into glucose. It is stimulated by hormones like glucagon, which comes from the pancreas and tells me that I'm hungry, right? That my blood sugar is low, or from cortisol, which is released from the adrenal glands in response to stress. So what makes the body take its stored sugar off the shelf and put it into the bloodstream? Hunger and stress. Glucagon and cortisol. Okay, I really, really do not want to keep you guys past class time. We've already gone 6 minutes over. We have less than 10 slides left to go. So please read these slides on your own. If you have any questions about them, just shoot me a message and I'll answer anything I can. But proteins, we're talking about proteins, fats, minerals. just more about nutrition. And I ran out of time because I can talk all day about nutrition. It's one of my favorite things. So slides are on Moodle. You have total access to them. Any questions? Any questions over anything we've gone over today?
So, after today, basically we have until the 7th to take our final.
Our issue is that our last day of class is Labor Day. And I get the smart thing to do would be to just push the class from like Monday to Tuesday. But the way the process goes is that we got knocked down to week 11. That's what happened. So.
Because the syllabus says we have class on the 7th. And you said that we don't have Zoom class on the 7th for some weird reason. I'm gonna check that.
Yeah, let me check that.
Okay.
I'm pulling it up right now. Give me just a second.
Is it that we're just taking the test that day, but we're not actually having like a Zoom call? Like the test is due that day or something?
Yeah, that's what I thought.
Because I think I think you talked about this last week, and I think that today was our last Zoom meeting. And
that was my impression as well, because next
Yeah.
week, all we have is the final.
Yeah.
And the issue is next week, Monday is Labor Day. So I think technically we get pushed off until the following Monday, like a whole extra week. We go down into week 11. But if what Anita says, let me look at the syllabus.
I'm
Yeah,
not the
because
teacher. I'm just looking at what is
I didn't write this.
because I'm
Sorry.
here like the beginning of next week, but
Holiday,
then like,
September 6th, class
Yeah.
September 7. Okay. So my brain was wrong.
But it also says we have a test to endocrine, reproductive, and digestive. So does that mean that our final is only on endocrine, reproductive, and digestive? Or am I not reading that right?
judging from the
That's what
syllabus,
it
that's
says
what
on
it
the
looks like it.
final review.
Oh, okay.
I think it's
So I'm just skimming over the final exam and endocrine, digestive, reproductive, endocrine, digestive, digestive, digestive.
It makes sense. Most of the material will be digestive because that's the newest material.
Yep. Reproductive, digestive. Yeah. I'm not seeing any nervous system or anything like that. So
I wasn't trying to be an ass. I just was curious.
I didn't take it that way.
Okay.
No, you guys deserve to know what's going on for sure. So let me make sure that the test dates are correct. So today is our final class, August 30th. We will not have a Zoom lecture next week because it is Labor Day, but the final test would still be due the following day, Tuesday.
Okay.
Okay.
That is good to know. Mark that.
It's on
Good
my
stuff.
calendar.
Let me double check the dates on this thing and make sure that it is setting this thing right. Close the quiz September 3rd. Nope.
Yeah.
All right. So the final exam is officially open. You guys have a week and a day. You have until Tuesday
Thank you.
to complete the final exam. And let me give you just a little bit more help. One sec. Your final exam is 20 questions.
Oh, wow. Okay.
However, some of those questions are like match a bunch of stuff inside one question. So
Oh,
just
gotcha.
like
Probably some like
one
word
has like
banks in there
5
too.
things to choose, and the other one has like 8 things to choose, but like technically those were only 2 questions. So there's 20 questions, but it's a lot more than 20 questions.
And then to clarify, it's on the last half of the course since the midterm on the systems.
Yes, endocrine, reproductive, Digestive.
Okay, cool. Thanks.
You're welcome. And then for the record, guys, there is also a 2-hour time limit on the test. So just be aware.
Well, thank you, Dave.
It has
for
been
this
my pleasure.
class.
Thank
It
you
was
so
awesome.
much.
Yes, thank
Yeah.
you.
I'll
No more
see ya.
questions, you guys? All right. I will see you all around.
You taught us well.
Have a
Thank
good week.
you.
Bye.
Thanks,
See you
Dave.
next term.
Bye.
I'll see you next term.